them is everywhere, one of them is half. To make that, because the dot, it looks like each other, no?
No. Go back, and I'm not sure what you're saying. Are you talking about chickenpox or herpes zoster?
Chickenpox and herpes
Chickenpox can be all over.
All over. Okay.
Yeah, it can be many areas of the body,
but
including in the mouth.
The thing that we see, like I have something here, it's the same. Means if he get it and I get it, that means it's going to be the same.
Yeah, for the chickenpox.
For the chicken. How about chickenpox and zoster?
Zoster is usually, it only affects one part of the body, and it follows a nerve. So a lot of times when you have herpes zoster, you only may have the rash going from the back coming around here.
It's
just
a
the lines.
Rash. It's not like a chickenpox. But the chickenpox is not a rash. I got it.
Well, it's a burning. You get a burning sensation first.
Okay.
Then it's kind of like a rash, and you get
But
ulceration.
the thing that we got it's the same. Means it look like same. Like, no.
Well, when you get chickenpox, you get one here, and you will have one here, and you will have here.
Okay.
In a rat, in herpes zoster,
it's like together.
Yeah, it follows the line. It follows the nerve.
Thank you.
But I mean, they may not touch each other, but they follow a line.
Thank you.
Now, if you have it on the face, it's one half of the face. Okay. And that's one of there are rare cases where you can have it in both places. Now, when we talked about, here's another, any other questions? I mean, another thing we talked about that you should think of as far as a differential diagnosis. When somebody has, let's say a middle-aged female, when somebody has this sore gum tissue, and it just sensitive to everything, when you look in there, she's got red areas, erosive areas. Sometimes you can even have blisters first, but often the blisters don't last very long in the mouth, so often you won't see the blisters. So often they'll have this for 6 months or so. It'll be very painful, especially any spicy food or anything. I mean, you're in pain. So what 3 diseases are you going to think of?
So the first one is going to be primary herpetic gingivitis.
No.
Why? Because it's going to be, no?
Because here's the key where you lost it. Primary herpes doesn't last for 6 months. Primary herpes only lasts for a couple weeks.
So
when you have herpes, you're only sick for a couple weeks.
Got it. Okay.
But the other ones, okay, so that's one thing. And a lot of times, primary herpes often is in young people, but it doesn't have to be. Most of the people that get primary herpes is 1 to 5. But if you've never been exposed to it, you can still have herpes when you're 20, 30, 40, 50. Not very often do you get primary herpes. But herpes only lasts 2 weeks.
2 weeks.
On a normal, somebody with normal immunity. Okay, so back to my original question. So somebody's got, and this is where all the students, when they answer that question, when I give them a slide saying, hey, this person's had sore gums tissue here for 6 months. Well, they think of primary herpes. That's often the answer. No, because herpes doesn't last that long. It could last that long in somebody had immune deficiency. Okay, they can have like primary herpes for a long period of time.
So it's going to be a blister? Is that
could be a blister, but a lot of times you don't see the blister, but of these diseases. What 3 diseases that I'm thinking of? If I had a 55-year-old lady come in and she says, "Oh man, my gums been sore. I can't eat any spicy food. I can hardly brush my teeth. I'm in pain all the time. Sometimes I bleed from the gums." Okay, it's going to go on 6 months. And she says some days it's better, some days it's not. Okay, and I look in there and here she's flaming red gingiva and they look ulcerated and they don't, it just doesn't look right. What 3 conditions would often I think of? And you thought of primary herpes, but no, it's not primary herpes. Because that's just 2 to 3 weeks.
Would it be something like NUG?
NUG only lasts short period of time too.
Okay.
And an older person, usually it's a young adult that gets NUG, and you don't see NUG around that much anymore.
You don't, huh?
No, I mean I used to, when I was in practice, when I practiced in a small town, I used to see a NUG come in. but I don't see it so much.
So would this be like pemphigus vulgaris?
There you go.
Okay. Membrane pemphigoid.
And what else?
So it's pemphigus vulgaris, mucus
Membrane pemphigoid.
And what else?
Can it be multiform or no?
No, it could be confused sometimes. You could confuse erythema multiforme with it too.
Because it's red too.
But it's red too, and you can have blisters all over the mouth. But often, erythema multiforme, often you would have a history of maybe, what could set off erythema multiforme?
Kidney, cardio, all that stuff.
Well, usually what can set it off is taking an antibiotic, having a herpes. Herpes sets off. People that have a herpes lesion, herpes labialis, can set off erythema multiforme. But often it's a allergic reaction to something.
Yeah.
Something, an allergic reaction to something in the air, the pollen, okay? So the other one you're not thinking of is the most common of the three that I'm talking about.
Erosive lichen planus?
Yes, erosive lichen planus. Yes. So you got to think of all three when you see that. And you have to think of erythema multiforme too, you know. And sometimes it's hard to tell the difference.
Yeah.
Now, what was the most serious of those three?
I would say
Untreated.
if it's untreated.
The erosive one treated, or the reticular, no.
Which one of those three, erosive lichen planus, pemphigus, pemphigoid, which one's the most serious? Which one would you not want to have?
Pemphigus.
Pemphigus. Why?
Because it's, I guess, okay, what's popping up in my head is like it appears quickly, the surface of the skin is like thinner.
And what happens, you form blisters, you can form blisters, and you form them in the mouth.
Yeah.
And a lot of times the blisters form, why do the blisters form in the mouth before the skin? Why often does the patient end up in the dental office before they see the physician?
Because
It first come and then it last to go.
yeah.
Comes what?
The blister in the mouth
Yes.
comes first and then.
Why? Why does the blister come in the mouth before the skin, usually? Well, not every patient that's way, but a lot of patients, they will have the mouth lesions before they have the skin.
Because epithelium is more thinner there and
No,
lots of.
but you're on the right track when you say something about the epithelium. The epithelium turns over faster in the mouth than it does on the skin.
Skin is
The
more
epithelium
thicker.
will turn over in about 30 days from the basal cellular. On the skin, it can be 60 to 90. So that's why. So what one's the worst?
Pemphigus
Yeah,
still.
pemphigus. Because why do you die? Why do you die if you get pemphigus and not treated?
You can eat, you can drink, so you can die. No.
Well, you could be fed through a tube or something.
Infection?
Yeah, infection. Infection, and what happens is if you have the blisters all over the body, you lose your electrolytes and all that stuff, and you can die. But not very often. People don't die of it now, because how do they treat them?
Steroids.
Huh?
With steroids?
Yeah, heavy doses of steroids. Yeah, and dramatic effect. But then they have side effects from the steroids. Yeah. How many types of lichen planus are there?
There's 3. Oh wait, no.
Planus? Two.
There's 2 main ones. There's about
Yeah.
5, but you guys only learned 2.
Yeah.
The reticular lichen planus?
Uh-huh.
Is the reticular lichen planus painful?
No.
No. A lot of patients don't know they have it.
Yeah.
Do you only have it in the mouth?
No.
No, you're gonna have it on his skin.
Are you sure?
No, erosive you can have.
Erosive, you
Yeah.
can have it? Okay, erosive. In the mouth, just in the mouth.
You believe me too much. See how I changed you? You were so sure.
I changed so fast.
You were so sure that they had it on the skin.
Yeah,
Yeah, it's like
And I asked you, are you sure? And you backed off. You should have said, yes, I'm sure.
I changed so fast.
Yes, you can have it on the skin. And it's where you were sane, but you weren't sure of yourself. All right?
Yes.
You often can have it, some of the areas are on the, can be well, come on, what's this part of the arm? I'm losing my mind.
Wrist.
the wrist, or the ankles. You can have it anywhere. You can have it in the genital area. You can have it other areas on the skin.
Oh,
I've seen some
everywhere.
patients with lichen planus on the back.
Oh.
But just because you have it in the mouth, does that mean you're going to have it on the skin?
Not
No.
necessarily.
And you're going to have it on the skin and not have it in the mouth.
Mhm.
But often when I saw a patient with lichen planus, I often said, hey, let me see your arms. Well, what are you looking at? Why do you want me to roll up my sleeve? Because I tell them, I want to see if you have lesions. And they would say, oh, I've had these red itchy things for a couple of years and the doctor doesn't know what they are. But they were lichen planus. So on lichen planus, it itches. So in the mouth, reticular lichen planus is asymptomatic. But on the skin, it's puretic. You may not know what the term puretic means. Puretic means itching.
Itchy.
Pruritus.
Pure.
Right. Yeah. Yeah. Any other questions you want to ask me?
So on
How do you tell the difference between primary herpes simplex,
primary.
herpes simplex,
Mm-hmm.
After?
and herpetiform aphthous?
We talk about it.
Location.
So for the primary, patient gonna have a fever.
Yes, that's one.
Yes. So
Often a high fever.
103 to 105. It's not that bad, but
Can be. That's one of the things that helps.
okay. So the blister gonna pop so fast.
Yeah, okay.
No scar.
No scar. Now, you said blisters
It's not.
in primary herpes, which is correct.
Mhm.
You have blisters in herpetiform aphthous.
I think the herpetiform is a hollow thing, like something that has a red hollow around it.
Yeah, halo.
Halo. Yes.
Yeah, halo.
Halo. No.
Do you have blisters?
No.
You sure?
Yes.
Good. They don't.
They do.
They don't.
They don't.
Ah.
Yeah. Okay. They do.
Okay, they don't.
They don't.
So,
What else?
how long you've had it can make a difference. But, so, here's another thing that will help you, where it's located in the mouth sometimes.
Oh yeah.
Primary herpes often affects the gingival tissue.
The other
But,
ones are movable.
herpetiform aphthous usually does not.
Mhm.
And what are the three types of herpes that you can have? I mean, three different stages. We said primary herpes.
Mm-hmm.
Yeah.
Everybody that has primary herpes, most people that have primary herpes, it's subclinical, right?
Mhm.
Mm-hmm.
When I say subclinical, only about 10% of the people, when they first came with the herpes virus, they had a primary. 90% of the people, it's subclinical. They may not feel good, they may be sick that day, but they don't know it's primary herpes, because they don't have these lesions all over the mouth. Does that make sense?
Mhm.
Okay? So, primary herpes, and
Recurrent.
then the next one on the lip is called what?
Recurrent labialis herpes.
Herpes what?
labialis.
Labialis. Okay? And then another type of herpes,
Recurrent intraoral herpes.
yeah, herpetiform, intraoral, okay? And you can have on the hand, and that's called what? On the finger.
Whitlow.
Yes, herpetic whitlow.
That one.
Yes. Any other questions?
So we have two post quizzes, right? Skin diseases in the mouth and then oral infection.
Yes.
Yes.
All right.
And they're all together, right?
Yes, they're all.
Oh,
all
one-
together.
Yeah,
One
they're
Yeah,
together.
there's
I think so.
11 questions.
Oh, there's 11 questions.
So I have a question. So on systemic sclerosis, so the patient cannot open mouth?
Yeah.
What's the difference between the trench necrotizing? Trench mouth means they can open too?
No.
No?
Trench mouth is ANUG, acute necrotizing ulcerative gingivitis.
Gingivitis. What
Okay.
is that one?
That is when people don't feel good, and why they call it trench mouth, because in the service, when Army guys were fighting, they didn't have good nutrition, they were cold, they were wet, all right? And so when their immune system went down, the normal organism in the mouth just took over. So it attacked the gingival tissue, all right? And so it eats away interproximal gingival tissue. And when you would see somebody with trench mouth, okay, like in private practice that I did, I knew it when I walked into the operatory. Why? Before I even looked in their mouth.
Look fatigue?
Huh?
Look fatigue means...
Look what?
Look sick?
Look
No.
sick?
No, it's okay.
No, the smell.
Oh.
There was a particular odor coming from their mouth because of all the necrotic tissue. And then you treated it, often how I treated it with the hydrogen peroxide, have them rinse with it 2 or 3 days and get on good nutrition. And often it would, and clean and brush it good. You know, nowadays they say scale it, but man, that's hard to scale. It's so tender. I mean, it hurts. I mean, it just eats the interproximal gingiva away on in there. Yes, yeah. And there are certain organisms that do that. I don't even remember what the organism is, but a couple of organisms that are found. Yeah. All right, you ready?
Yeah.
So here is, you guys are familiar with this book?
No.
Oh.
Never see it.
I mean, this is one of the, and you guys can,
Does it have a picture?
yeah, it's full of, that's what it is.
That's good. It has a picture.
So, and there's another one, a bigger one, and I didn't have that with me. I'll bring it next time. It's even a bigger one. But you guys can just pass that around.
Okay.
You know, share it. All right. Yeah. I mean, that's one of the color atlases that they have, and they may have that in the library too.
Oh, yeah.
You can take
Yeah.
a picture and then ask them.
And there's a better one that I have, but they don't even produce it anymore. And I don't know why. All right.
Oh, yeah. Pretty. Oh, they have a bone.
Yeah, they got bone lesions there.
Oh.
All the time.
That's pretty.
Okay, and the other thing, all right. You guys looked at movies where the secret people pass secret things around, right?
Oh, yeah.
Okay, so here it is. Okay,
The secret.
the secret. So,
Thank you.
so now,
You're gonna
what's,
figure it out and
what's
then
on
I'll
that
share.
now?
Your PowerPoint.
Yes, and actually not, one of them's not mine too. One of them's another faculty member in here. Okay, it's from an endodontic person, and the reason why you don't want to pass it around, or shouldn't, no, let me end this out, because it's got her name in it, and she's another instructor, but she worked in my department. So you'll see another name. In fact, her daughter is a freshman dental student.
Oh,
Yes, yeah.
okay.
So I just talked to her in the hall a few minutes ago, the daughter. But anyway, so what's on there is epithelium and pigmented, so you can study for next week's
Or next
test.
Oh,
Okay?
perfect.
So bring that next week, and on Thursday morning, give it to me, and then I will put soft tissue and the next ones on there. Okay?
Yeah.
And then, actually, these PowerPoints had some entities on there that you guys didn't have, so I took some of those off. I didn't want you to get it.
Thank you.
Thank you.
Oh, yeah. Thank you.
And it may have some stuff you don't need anyway. But
Okay.
anyway, so, and the reason why you don't want to share this, because some of these have full patient pictures of their face,
Oh, yeah.
and you become, I would become liable. So use it for your own,
Yeah.
but don't pass
Don't
it
share
on.
it with us.
Okay.
Okay, all right, and then bring it next time.
Yeah. Sounds good.
And the best thing I would do with the thing, I wouldn't transfer. I think the best deal is don't transfer it to your computer. Just pass it around. You use it for a few days and pass it to the next person.
Okay.
Try to pass this around.
Oh, thank you.
All right, you got those? Okay. All right. This is number 1. Whoops, there one up there. Can you see what we're looking at?
Yes.
We're looking at all these little, there's little tiny blisters. Or not blisters, they're ulcers now.
Also, yeah.
And pain like this. I mean, it's like clap. This gal was a secretary here in dental school. She's retired now. 2 weeks later, she got the same thing on the opposite side. Okay, next?
Yeah, next.
Okay.
Does he have blister or no blister?
You know, it doesn't say.
It doesn't say.
It doesn't say, and it's not. Right, ready for the next one?
Mm-hmm.
Okay, 3. This one's a giveaway.
That's an easy one.
Okay, number 4. You know, and she's asking something different here.
Oh,
She's asking
I didn't read
not what it is.
It's coming off.
When you read her question, she is asking
What the reason?
manifestation of what infection.
Wait, what?
What does it mean? Means what is cause of it? What?
Yeah, what is the infection that causes it? Is that what she's asking? Or is she asking, what do we call this?
The
No.
palate lesion.
Like what? What infect?
So,
What's causing it?
so I would put both.
Oh.
I mean, I would put both answers there, because I'm not sure, you know, this is a common oral manifestation of what, of what infection?
So are we supposed to write what it's causing it, or what it
Yeah, I
is?
guess she's asking, I would put what disease, what the disease is a manifestation of what systemic disease, and then what is the cause of it? See what I'm saying? She asks manifestation of what infection? She's not asking for,
Put the name of the disease.
I would put the name of the, I would put the name of the disease, and also then what causes that disease. What virus causes that disease?
Oh, the virus?
I think that's what she's asking.
That was bacteria. That was not virus. Was it virus?
This is a test.
Okay. I don't know.
So I'm not sure what she's, I mean, if you want to get picky of what infection. I mean, I don't know, both things then. Okay, number 5.
Can you go back to that one?
I mean, she put the finger there for a certain reason. Are you wondering why the finger is there?
Yeah. Like,
It's not real,
okay.
it's not, doesn't jump out at you. It's not a good example of it.
Oh, I see it.
You see it now?
Yeah.
There are some pictures that have better examples of it. But actually the histories, she's got a great history that tells you what it is.
Yeah.
Okay, number 6.
With the swollen glands, is there an exit to it, or is it just swollen?
Just swollen, yes.
Is he playing with a cat?
Getting too comfortable.
1, 2. I mean, you're thinking, which I like.
Yeah, I know it's not that one.
I mean, that's what you should be thinking.
No, there's no cat.
There's no cat though.
No.
Well, she doesn't say that. How do you know there's no cat?
If that was a cat, she mentioned he has a cat.
Why would, no.
Oh, he
That would give it
collated a
away.
cat. It's not a cat one, I'm pretty sure. No cat. Oh no, not this guy. Can we back to the kid one, please?
Well, wait a minute.
Oh man.
Thank you.
Well, just because she says there's no cat You don't always know if a kid gets
A scratch.
scratched by a cat.
That is true.
You don't know that.
But she didn't mention it. That means
No, that was giving it away.
It's possible. I mean, I could think of two things, but
Yeah.
This is not the same kid. It's not the same picture. It's two different people here.
How
And he's
do
got
you
the
know?
swollen area here, and this is in behind the swollen area, so it's not the same, not the same picture.
Are we allowed to put two answers?
If one of them
You
is
know-
correct, she's gonna give you half.
Yeah.
Yeah, is that, I think.
Yeah, she did
Yeah.
to me last time.
She did.
Yeah.
either half or all or nothing.
All right, here we go. 7.
Oh, it's.
Okay, number 8.
That means he has a blister for a year.
No, he's had blisters for a year.
Oh,
He's
going and then
Going, coming,
coming in now, coming in now. Got it.
and he started. Yeah, and then maybe he had blisters in his mouth, started with in his mouth. I mean, his mouth, you don't see blisters because they're all ulcerated, and so now he's got left as an ulceration, because blisters aren't gonna last very long in the mouth. All right, you ready for 9?
Yes, please.
On your exams, were they always on a timer?
Yes,
Yeah.
we always had a timer for quiz,
Okay,
and
so how long?
very short, very
Like-
short.
Maybe.
Each question
A
we
minute?
had 1 minute.
Yeah.
minute.
1 minute, a minute for each question. Yeah. After 10 minutes, 8:15, that was done. So she started to teach us
Did you quiz every time?
every time.
Every period?
Every time that we had a class, we had it. We had a quiz.
Yeah,
Yeah.
In the morning, when it started before, we had a quiz.
from the previous.
yeah
material.
previous material.
Okay, here's number 10.
Do we have to be very specific?
You know, that's a question I have. I wasn't specific. I mean, you could be, if you were, you could put both, maybe one more specific, one less specific, the overall general thing, and
Okay.
specific the way you see here.
Okay.
Diagnosis means the name of that thing or the thing that it caused it. The name of it, yeah. I think so.
Yeah, I mean, that's, to me, that's both. Ready? Okay, number 11.
Can I ask a question?
Huh?
Can I ask a question, please? Meaning of the word, yeah?
Yeah.
What is life-threatening? Means killing? Life-threatening?
Threatening?
Yes, means killing,
Anything life's threatening, it could kill you.
killing.
If anything's like, if I come with you with a knife,
Got it.
right?
Thank you.
I'm threatening you, right?
Yes.
I'm threatening your life.
Can you go back with number 10? I was just having trouble.
He didn't mention when you wipe off, so there is no blood, nothing.
She didn't say that. But don't think, but just looking at this, I don't think you have to know that. This child just finished antibiotics.
I know, that was for...
That tells you something right away. And then don't forget the last 12 and 13. You have a very pretty smile.
Thank you so much.
Do other people tell you that too?
When I was younger.
Really?
Yes. Later on, I don't get any compliment. Compliment?
Yeah.
Yes.
I don't get it. I think because I'm old, so I'm 30 something. So when I was younger, yeah,
They
they
say
said
you had a pretty
you have a
smile.
pretty hair, pretty smile,
Yeah, you do have a
all
pretty,
that stuff. But
you do have a pretty smile.
recently,
so
none of them. Thank you.
pretty.
Thank you so much. I'm stuck on that one.
You shouldn't be. It just jumps out at you.
Like, how specific does she want us to be? That's the thing.
I would put both answers.
Okay.
I don't know that one.
I mean, it's a patient who's been on antibiotics. What does that tell you?
Well, I know that one that it's wipe off, it's gonna be bloody, so it's not that one. The white thing come up.
Who said that doesn't wipe off?
White is fine. It come up.
Oh, because he came
It's
back.
wipe up.
He did come back, and it's still there, right?
No.
What he's saying is he was on antibiotics. Now he came in the office because after the antibiotics, because he's got these white lesions, and they wipe off. And she's giving you the whole history. She's giving you the diagnosis right there. White lesions that wipe off after taking antibiotics. I mean, the next hint would be give you the diagnosis. Okay, answer the last two. You guys are gonna have to help me with 13 because I'm not sure I know the answer.
Yeah, I put two things, but I'm gonna have to erase one.
When we get it in the childhood?
Do what? Erase one?
Yeah,
What do you mean erase one?
like I put two answers down.
For what?
For number 13.
Oh. I don't know what she wants. I mean, I can name it. When she says young adults, I think I know what she wants, but I really don't know what she wants.
Yeah.
It's a disease that all of us got it when we were a child. It's an easy one. I think so. I don't know. No?
Well, no, because she's saying the skin disease have oral lesions in the middle age or older individuals.
But the question is which one happened on a young age? The question is which oral skin
Maybe I'm reading
disease
it wrong.
happened in a young adult? I thought it's on a oopsie.
Oh,
Young adult.
Young adult means child or no? No?
Like maybe.
19 or 20?
Yeah, like.
Oh, it's not that one. Young adult.
She's not giving me enough information. Well, I think I know it. Okay.
College student gonna be young adult? I think so.
Okay, I think I know what she wants now. I think Heidi helped me answer it.
Young adults. What do you do when you're young?
You
Okay.
guys are.
Are you guys done?
Oh goodness.
so,
I did
yeah.
so bad.
Can we
All
go
right.
over it?
Yeah, we'll go over it after you hand it in. Or you can keep it and then
We don't
I'll read it.
change.
Okay. Okay. This one you shouldn't have too much problem with.
Intraoral.
Pardon?
Intraoral.
Yes.
herpes.
Simplex.
Yeah.
Recurrent intraoral.
Mm-hmm.
Recurrent intraoral herpes.
Yeah.
Okay? Did you get that?
Yes.
Okay, next.
It's pemphigus vulgaris.
That's what I put too.
I mean, it does have that disquamative gingivitis.
Yes. It is, clinically, it is a disquamative gingivitis.
Uh-huh.
What is the top of your differential diagnosis?
The spicy food? I don't know. Actually, no.
What'd you put?
Pemphigus vulgaris.
Vulgaris
What'd
because
you
it's
put?
6 months.
Yeah.
What'd you put?
Vulgaris.
What'd you put?
Same.
Why didn't you put benign mucous membrane pemphigoid or erosive lichen planus?
I mean, those are possibilities.
Yes, they're possibilities.
But I just chose one of them.
So why did you choose that one?
Well, I thought maybe because the blisters had already popped.
But most of the time erosive lichen planus doesn't have blisters. Rare ones can, but pemphigoid and pemphigus do.
Yeah.
Right. I mean, to me, my first answer, and I have to admit that's a possibility, okay? So I put erosive lichen planus first, and then pemphigoid. I think pemphigoid is a better answer than erosive lichen planus, but I would have to say pemphigus also. But pemphigus is usually more severe.
Pemphigoid membrane, it's more severe.
Yeah. So, I mean, when I see a patient like this, I think of all three things.
Yeah.
But I think of all three. But which is the top of your differential diagnosis? Well, one of those three. Well, pemphigus wouldn't be on top of my three, but it sure could be. So, I mean, that's not a wrong answer. I just don't know how strict she gets. That's what I gotta find out, okay? So, I wish you guys would have put pemphigoid. It's more, when you say middle-aged female, or erosive lichen planus, it's usually typical of a middle-aged female. So I actually put erosive lichen planus dash pemphigoid. I didn't put pemphigus, because that's usually more serious.
Yes, yeah,
Okay.
it's not pemphigus.
And I'll say why it's not pemphigus, because she put pemphigus on another answer later
Yes,
on.
yeah.
That's
Yeah.
what I put 2 pemphigus, but that
Yeah.
one a number
Okay.
9.
No.
So what is three?
Hand, food,
Good
and
mouth
mouth
disease.
disease.
Okay, what is this one?
It's infectious
Epstein.
mononucleosis.
Right,
But it's not
what is
acid.
she asking?
For the
The viral.
disease,
Viral. What is it?
Epstein-Barr virus.
Epstein-Barr. So I put both. What'd you put?
Do both.
You put
But
both?
I put the line on it.
I scratched out mononucleosis,
Yeah, me
and then I just put Epstein-Barr.
Yeah, I don't know what she said. I mean, I don't know if she wants the disease or the infection. I mean, what,
Yeah, Epstein.
okay, senior is a common oral manifestation of what infection? The infection is Epstein-Barr.
Yeah.
Yeah.
But what if you just put infectious mono? I don't know how technical she gets, so. Okay, how about this one?
Is that
Classic, bloody crusty lips, a young person, he just was on antibiotics and we just talked about this,
it's
few minutes ago.
Multiform?
erythema multiforme, classic for that. Did y'all get that?
Yeah.
Good. And actually, the target lesions are not a good example of the target lesion. Usually they're better example. She could have had a better example.
Oh, that guy.
You know, and this was an interesting patient because he thought he had an oral venereal disease. I took these pictures on him. Okay, here,
Okay, so
you put what?
I was thinking about cat scratch, but then I
That's
scratched
what it
that
is.
out. What?
No.
Don't do that because
It's
like
actino. It's not actino?
Is what?
Actinomycosis.
No,
Actinomycosis.
it's not draining. There's no draining area.
So you could specifically see a draining area.
You would, usually, not always.
Okay.
Later on you would.
What
I never even thought of actinomycosis, but now that you say that, yeah. But you usually don't see that in a young kid. This is classic of cat scratch disease.
With kids.
Why she didn't mention he had a cat?
Yeah.
Well, she didn't do that because it gave it away.
But how would you be able to diagnose it, you know? Like,
It's hard.
what if
Cat
the kid
scratch disease is really hard to diagnose.
Yeah.
Yeah, they have trouble making a diagnosis. Yeah. So I don't know how you guys chose that. I mean, I knew the picture right away, so I knew what I mean, you just told me, no apparent reason.
That kind of made me think like some bacteria maybe caused it that he didn't know.
Right with this thing.
Mhm.
She will give you 0.
Yeah.
I grade them.
Oh, you're gonna grade them.
Yeah.
Awesome.
Okay, 7.
Medium rhomboid glossy.
You know what? I couldn't even think of it. Because I haven't taught Path for a couple of years,
Wow.
I couldn't think of the name. I had to look it up. That's terrible when you can't remember.
Yeah.
We had an instructor, she didn't know about aphthous and herpes. When we said, she asked, what are those?
Who said that?
One of our faculty. And we have to memorize all that stuff.
Okay, what else? What's this one?
Vulgaris?
Yes,
Vulgaris.
classic.
It's so bad.
Okay, I thought it was one of those 3 things, but I put erosive like uveitis.
2.
I think if I had switched 2 and 7, I would have been better.
See.
But,
See, when he said ongoing blisters and crusting sores on the skin, lichen planus doesn't have these many crusting and sore lesions on the skin. You can have little small areas on the skin, little red itchy areas, but not blisters and stuff. So this is typical of classic of pemphigus. Yeah. Okay, what's this? You better not miss
Lichen
this one.
planus.
You miss when this missed, you guys are gonna have to run around the table. Like classic lichen planus.
Lichen planus.
Reticular lichen planus. Why did you have a problem with this one?
Is that pseudomembrane candidiasis?
Is what?
Pseudomembrane candidiasis.
Yes, yeah.
But that
Or
one
I put candidosis.
no,
or
we have
monolysis.
6 of them. We can't
Well,
put
candidosis it is a candidosis.
I know it's a candida.
Candida.
Yes.
It's a candida.
We have 6 of them.
What if it's all candida?
Okay.
So to me, any of those, candida, you're just more specific. You just probably gave a better answer than I did.
Well, for the pseudo, when we come off, wipe up,
Yes,
bleed
right.
is coming. This one doesn't have a bleed.
Or no, it would if you did it.
But
So
just
this is probably a pseudomembranous, which is one of the different varieties of candida. So candida is, I just put candidiasis.
Yeah. Okay.
And you were more specific, your answer probably better than mine, okay? But both of our answers are right. Did anybody?
Oral.
Yeah,
Candidiasis.
yeah, more candida.
Pseudo.
This one,
Recurrent labialis, herpes labialis.
yeah, this was a dental student,
Uh,
and he really got nasty ones up, they were classic. Okay, answer to 12,
I put,
pemphigus.
yes,
yeah, that's what I put.
do anyone it could be.
How about zoster? So zoster needs herpes zoster.
It's
That
not-
needs
it's
treatment
not,
too.
it's not life-threatening, painful but not
Not
life-threatening.
okay, got it.
Okay, 13, I have no idea.
Labialis.
Yeah,
Herpes
that's what I-
labialis?
That's what I put.
Herpes
too.
labialis.
You put what?
Labialis.
Herpes labialis.
Cause it's like young adults.
Wait a minute, herpes labia. Most of the skin diseases that have oral lesions occur in middle age and older individuals. That's true.
Okay.
What is one example of an oral skin disease that typically presents in young adults?
Yeah.
Is she saying these two things are related?
Yeah. That's what I think. That's what I thought. Yeah.
I think she was giving us a fact about older individuals, and then she wanted us to give an example of a younger.
Of the same disease? But she just
Oh.
talked, no, she wants a disease, I think, where a person may have lesions at middle age or older, but what is one example of an oral skin disease that typically presents in young adults that's related to skin diseases in an older age?
Oh, I didn't know she was putting it that way.
That's the way why would you put I put
Yeah.
chicken pox.
Yeah, I put chickenpox too first, but you mentioned it's not a young.
But I also, first thing I thought of is erythema multiforme.
Oh, I didn't think about
That's
that
young
one.
adults. But they don't have, but most skin diseases that have oral lesions in middle age or older individuals. What is one example of an oral skin disease that typically presents in young adults? I don't know. I have to say chickenpox, but I don't know. Where'd you put?
Yeah, herpes labialis. Because I thought
Herpes.
Yeah.
I put
I just thought
Why are you putting herpes labialis? Oh, because you didn't pay
Yeah.
attention to
To
the
the
first
first part.
sentence.
yeah, I
You
thought
just
she-
paid.
Yeah.
But what is one example of oral skin disease that typically presents in young adults?
Yeah.
Herpes labialis. I agree, but
Okay.
you didn't relate it to the first sentence.
No.
So what you put, Sarah?
first I put chickenpox, and then you guys said young adult, not children, so I put labialis. College, young adult. I thought it's herpes.
I don't know how you guys put labialis.
It's not labialis.
Okay, what'd you put?
Yeah, the
Young.
same thing as her scratched out. The varicella, because that's chickenpox, right?
Yes,
Varicella.
herpes.
Yeah.
But young adult,
varicella
they won't
zoster.
get-
If you put varicella zoster,
Yeah.
that would be a right answer.
Oh, zoster?
I think that's what she's asking. I don't know. I mean, I have a problem with that question.
Young adult.
All right, hand me your pick. I mean, overall, you did pretty good. You shouldn't have missed that one. Number two.
Cat scratch too, I missed that one too.
Yeah, I think
I
you
missed
shouldn't,
three
you
of
shouldn't have put pemphigus vulgaris. That's
Uh-huh.
more serious.
Okay.
All right.
Maybe the color atlas would have helped.
Oh, are we supposed to have another quiz?
Oh, yeah.
We gotta get going. Somebody too, we can be here till 7.
Did you?
Pre-quiz for, you guys study pigmented lesions, right?
Yeah,
Yes.
we're supposed to study.
What do you mean you're supposed to? You're spending too much time with your boyfriend.
No! No!
I'm gonna have to get his telephone number and say, leave Sarah alone, she's taking my class.
We're not allowed to socialize.
How many questions are in this one?
You know, I haven't even looked at it, to be truthful.
Let's see.
Okay, that one is not that
I need,
bad. Hopefully. Too close. Did you get there?
okay, this is a pre-quiz, and it is pigmented lesions.
What is that? Oh, pigmentation. Okay, got it.
Oh, there's only 3 questions.
Wow.
Perfect.
All right.
Smokers, okay. Addison. What is Addison?
Addison's disease is a problem with your adrenal glands, and usually caused by several things. Could be autoimmune, that's most of the case, could be caused by other diseases. So you get tired, all right?
Yes.
And you also get pigmentation of the gingival tissue. Why?
Because of the hormone.
Yes, because what happens in Addison's disease is, let me tell you a dental student. So there was a dental student here years ago. He was like a junior. His wife worked in oral surgery. Oh, once, middle of the day, he'd just go home and go to bed. Well, she was getting ticked off. What's wrong? He's lazy, you know? Well, he was just tired all the time. Well, finally, when they did a workup on him, he had Addison's disease. So that's one of the characteristics is being overtired all the time, right? I mean, and then they finally made the diagnosis. And so the treatment for Addison's disease is given steroids. But why do you get pigmentation? You get pigmentation because the pituitary gland is saying, hey, put out more adrenocorticosteroid hormone, right? So it's making the pituitary gland work harder, but the pituitary gland also has a melanin stimulating hormone in it, so it puts that out. So that makes the pigmentation. And then the pigmentation occurs in areas that have more trauma. What areas in the mouth have more trauma? Gingival tissue. So that's why you get pigmentation of the gingival tissue. And those two girls, I just gave an answer and they weren't listening.
Wait, what? What did he say?
So that's why.
Yeah.
That's why pigmentation is related to Addison's disease.
Okay.
Because your adrenal glands is not putting out steroid. And so that's making your pituitary gland work harder
Right.
to put out that adrenal cortical hormone.
Yeah.
And
And
so
so,
that
yeah.
stimulates
Mel-
melanin stimulating hormone that's also one of the hormones in the pituitary gland. And so that stimulates
Bronzing.
yes, yeah, or also can stimulate your gingival tissue.
Yeah.
And one of the early signs is pigmentation of the gingival tissue. And why gingival tissue, not other areas? Because it's where you have irritation that stimulates activity within that epithelium, so it lays down the pigmentation. So you could have pigmentation in other areas, but the most areas is gingival tissue. So often having this symmetrical pigmentation of the gingival tissue, and this person's really tired, weakness and all that, could mean that they're coming down with Addison's disease. All right? Or you got it? You got your names on here, you guys?
Yes.
What happens? Do you get ticked off at me if I call you guys?
No.
What's this new society nowadays? You gotta. Oh, I can't even call you girls or boys.
Oh,
You know-
Why?
Why?
Yeah.
It's sensitive.
Oh, it's sensitive.
So
Oh,
no,
I
you
think-
call
yeah.
them person nowadays.
Yeah.
You gotta say person.
Yeah.
How stupid we're getting. We're getting so stupid.
Yeah.
So, did you read in Portland? They took all the urinals out of the men's bathrooms. Have you read that?
Really?
Take
Yes.
out what?
Yes.
Wow.
In one building.
When they pee.
Wow.
Yes.
Why they did that? How they can do pee?
I guess in the toilet?
Oh, they have to
Yes.
sit.
Well,
Yeah, I know, it's stupid. But they did in one building. Yeah, it was on the news.
Just cause it's not like.
In my country,
Yeah.
doctors said it's not healthy to do that, boys and men, to stand and then do pee. Because
Why?
the kidney won't be all empty. They have to push the not the kidney,
Really?
the gallbladder.
I never heard that before.
They don't do that. They do it, but it's not healthy for
Well,
them.
I'm still gonna stand, so.
Yes.
it's more convenient.
Yeah, it's more healthier to push the.
But they didn't do it for that reason. They did it for the
No,
reason.
no,
They
no
did it for the
reason.
reason we
I
don't
think it's
wanna.
that.
I don't know. I had never understood. They had a reason on the news, and I never figured it out. You know,
Portland is a weird place, though.
Portland is a weird place.
Yeah.
That's right.
Yeah.
Portland is a weird place. Okay, here we go. Oh, this is filling. Oh, that's great.
Yeah, that's easy
Yeah.
one.
I can answer these. Okay, next. And she's got a key here that helps you slowly spread. I mean, that really helps you in this, if you have any question.
If I see something like that, it's gonna be cancer. So I don't know why. It's a cancer. I think so. No?
Well, I didn't say one thing or another. You're taking the test, not me.
We don't have a cancer here.
Okay, you ready?
Yeah.
I took these pictures too. All right, ready?
Yes.
Wait, what else?
What do you mean the question? You didn't see any cancer?
If I have a patient with that,
You said that's not cancer.
it's a kind of cancer.
It is or isn't?
It is.
Right.
Because it's spread slowly,
Slowly
and it's
spread.
so bad
So what kind of cancer is it?
regarding. Because it has color. It's melanoma.
Melanoma.
Yeah,
Is that melanoma?
Yeah.
I think it's melanoma.
Oh.
Okay, what is this?
A smoker's.
Smoker's melanosis.
Yeah, smoker's
Look at that
melanoma.
right. This dark areas then gingiva slowly spread for a couple of years, and she put adult smoker. That's leading you astray a little bit. Doesn't have to be a smoker. What is the best diagnosis? When something's slowly growing like that, and that's strong, you gotta think of melanoma.
Okay.
Right. And you missed it. You put oral melanoma macula. Oral melanoma macula would never be that big. It's usually female, young person, and it's usually a small area. It'd be a small area. It would not, it can't spread, but you would never have one that large.
Okay.
But that's why it would be that large.
So the last one is amalgam tattoo, but the point.
The last one, what?
The question three, last question.
Yeah, amalgam tattoo.
So
Oh,
the
okay.
point that I was
Yeah.
not sure, I was sure about the last one, but the other one is close to the gold crown.
Okay, but
But we don't
if you
have
will
a,
look, why? I mean, here's the history. I know why it's amalgam tattoo. You haven't done dentistry. So they're cutting the crown prep, right?
what is that?
So before that crown was put on there,
Oh, okay, that was
Okay,
the amalgam with the tooth.
they're cutting the crown with a diamond burr, right? Doing the crown prep?
No,
What do you mean no?
we don't know
How
that
do you get a
crown.
crown?
We don't make a crown, do we? Oh, we do the
No, you
impression.
don't.
We do an impression. And
No,
then
but when they're prepping the tooth, how do you cut a tooth down and put a crown on? You have to prep it. You have to cut it down.
oh, cut the tooth.
Right,
Oh, got it. Okay.
yes, okay. So when you're in there cutting this tooth, what happens? The tissue sometimes comes over, and let's say there was a big amalgam in the side of that tooth,
Okay.
okay?
Mhm.
So the tissue comes over, it touches your burr, okay? So, and your burr has amalgam on it, right? From cutting this tooth, doing the prep. So that put amalgam in that tissue.
Got it.
I mean, it's got an amalgam tattoo because the dentist should have kept that tissue away. But, I mean, here's an amalgam tattoo right here,
Oh, wow.
all right? So what I was doing, I just was cutting a prep on a big tooth, had a big amalgam, and I was looking somewhere else and went to grab for the handpiece, and I stuck the burr into my hand.
No.
So it had amalgam on it. So that left an amalgam tattoo.
Good.
So if anybody says, do you have any tattoos? I say, yeah, I have a tattoo. Well, can we see it? Yeah, right there. That's the only tattoo I have. I don't like tattoos on the skin.
Really?
No, I think they look horrible. What happens when you get 80 and you still, these women have these tattoos? They're gonna look terrible. You know, some guy, whoever can invent to get, who's gonna invent an easy way to get rid of tattoos is gonna make incredible amount of money. All right. Okay, let's go back and finish. We're talking about, okay, so we were talking, let's get our epithelial hand up here. We were talking about, now, when you have a lesion that's just white in the mouth that won't wipe off, clinically we call it leukoplakia, right?
Mm-hmm.
Okay. And if you biopsy a leukoplakia, it can be what? What are the 4 things it could be?
Leukoplakia.
Okay, if you biopsy a
Dysplasia.
leukoplakia,
Oh.
name
Benign.
those 4 things.
Benign.
Keratosis, benign.
Hyperkeratosis.
Benign keratosis or
Yes.
hyperkeratosis.
Uh-huh.
What else?
Dysplasia.
Keratosis with this,
Dys-
because it's white, use the term keratosis with dysplasia,
Okay.
okay?
And
If it
then
was red, it would only be called dysplasia. Okay, that's 2 of them. What's 3?
it's squamous in situ.
Carcinoma in situ. That's
Carcinoma,
squamous.
yeah.
Okay,
And then
What's 4?
squamous carcinoma.
squamous cell carcinoma.
Carcinoma.
Yes, put squamous cell carcinoma. So those 4, okay? So, the keratosis with dysplasia is a premalignant, it is a premalignant lesion.
Mhm.
So dysplasia can be mild, severe, or
Mild, moderate,
severe.
severe.
Right. So here's 2 cases of keratosis with dysplasia. Now, my question is, will a case like either one of these, and let's put this so let's see it here. Will these eventually go into squamous cell carcinoma? Will all dysplasias go into be squamous cell carcinoma?
Yeah, it's
Potentially.
not. Yeah.
No,
No.
no.
Why?
They
is
won't.
that?
Some will stay, some will never progress. They can. You can't tell which ones are going to, but some will never progress into a squamous cell carcinoma. Let's see where she has, where does she have keratosis with dysplasia? Oh, on page 6. So it says here, keratosis dysplasia most often presents clinically as a white patch, but may also have redness also. They may appear both leukoplakia or speckled leukoplakia, and we've learned that, okay? So histologically, it's surface keratosis, then we got some epithelial dysplasia within the epithelium, but no invasion, right? You don't have invasion until you have squamous cell carcinoma, okay?
Oh, okay.
So now, how do we know these areas are dysplastic? We only know it because from a biopsy, okay? You can't tell looking at them. And we showed you these dysplastic cells the other day. Here's a couple on the tongue. I mean, here's an area really hard to see right here, right there. And that was dysplasia, right? But it's even hard to see. Now, you could see it in real life better than the picture. Here is actinic cheilitis, okay? But actinic cheilitis is only a clinical term.
Yeah.
So if you biopsy this, your diagnosis is not going to come back actinic cheilitis. That doesn't tell you if it's benign or malignant,
Yeah.
right? It's
Yeah.
like the term leukoplakia. So you would have to say dysplasia, or keratosis with dysplasia, okay? And when you see an area on, like on the left, you would want to biopsy in more than one area in the mouth, like here, right? And remember, the area in the mouth that we talked about yesterday that has the highest percentage of showing dysplasia when you have a white lesion is what?
The floor of the mouth?
The floor of the mouth.
No,
Do you remember the percent?
45?
About
40
45%.
something, yeah.
What are the other high-risk areas?
Lateral of the tongue,
The lateral border of the tongue,
vermilion of
the lip, the lower lip, floor of the mouth.
Yeah.
That's 3. What's the third one? Fourth one?
Gingiva? No gingiva?
Soft palate?
Soft palate. Because remember, it's areas that are non-keratinized. Non-keratinized are more vulnerable to dysplasia than
Yeah.
keratinized. Now, I'm not saying you can't have squamous cell carcinoma on the gingiva. You can have dysplasia. You can have dysplasia on the gingiva, right?
Yeah.
Yeah. Okay. Verrucous carcinoma you guys don't have, so I took this off. I don't think you have verrucous, right?
Which are you?
Did you put this in here?
This is the, epithelial, yeah,
No, she didn't put it in here. No, just verrucous carcinoma basal cell. Okay. All right. So erythroplakia we had, it's just a red area, right?
Yeah.
And most red areas, erythroplakia is a clinical term only. Now, most erythroplakias have a much higher case of dysplasia or carcinoma than white lesions, right?
Yes.
Remember? Like up to 80% can show dysplasia or that, okay? Here is the question on your test yesterday.
Oh,
the
that was
picture.
erythroplakia?
That was the one that, you know, she wanted, what's your most likely two diagnoses? Well, were they clinical diagnoses or microscopic diagnosis? I don't know. I gave
So
you credit
is,
for that.
is that speckled? Or
Yeah, to me, in some ways, that's speckled. But when you look, yes, I would call that, clinically, I would call it speckled.
Yeah, I
leukoplakia.
chose the speckled.
Yeah, because it's
'Cause I
got both
thought
red
it's
and white.
pink.
Yeah.
But it's not.
Yeah.
Okay, erythra.
Okay, erythroplakia, fine. A red pex that cannot be clinically or pathologic diagnosed in any other condition. Etiology presumed to be the same as those associated with squamous cell carcinoma. May occur by itself or be associated with leukoplakia. It's called erythroleukoplakia. May be plaque with a soft velvety structure. Remember we talked about that? Often like sandpaper. 60 to 90% shows dysplasia. CIS is carcinoma in situ or squamous cell carcinoma. Here's a couple of cases. These are speckled leukoplasias. And most of these are highly high dysplasia or squamous cell carcinoma.
But that one was not white to the right? Oh,
Yeah,
no, it has
was white.
something.
Yeah.
Oh, yeah.
Yeah.
There's something.
Clinical, so speckled leukoplakia is only a clinical term, higher degree of malignancy than erythroplakia. So speckled leukoplakias even have more malignancy than a erythroplakia.
really?
Long-term follow-up is suggested because of recurrence or multifocal closal involvement. Okay. Okay, squamous cell carcinoma. So on squamous cell carcinoma, that means you have invasion of the epithelium. Okay. All right. And, you know, you got a high percentage of people who die every year. And up to about 20 to 30,000 people. Our cases, I should say 20 to 30,000 people get oral cancer. Average age is around 60. But etiology is smoking, people who smoke, alcohol, viruses, and especially HPV, and we didn't talk about that. And we're not going to get into it too much, but what is the fastest type of oral cancer today? That's
HPV.
That's HPV.
Yeah.
And it occurs in what?
It's a virus.
It occurs in what age group?
Young.
Young what?
Young adult.
A male?
Young males.
Oh, young.
Did you
adults.
get that class? Did she talk about that class? Why?
Not why, but we just kind of memorized that. There was that was more prevalent in males.
Why?
Smoking? No.
No, it's not, actually, it's not much related to smoking.
Oh.
And it's usually white males. It's the fact, because the type of oral cancer, usually most oral cancer was talked about, was caused by smoking and using alcohol. If you go back 30 years, what percent of people smoked in the United States?
A lot.
Close to 50%, if you go back to the 40s. What percent of people smoke now in the United States? Roughly.
Maybe
Yes, yeah.
25%?
Well, it's around 14, 15, 18%.
Oh.
Okay?
Mm-hmm.
So when we thought of oral cancer, we usually thought of the older male, 60-year-old male who smoked and drank. But now, what's happening, less and less people are smoking.
Mm-hmm.
Okay? So oral cancer is somewhat going down. But oral cancer now is going up. The smoking is going down. So what is the cause?
Mine.
And now it's the young male, 30, 40 years of age. So why are the young males getting cancer who don't smoke, white males? Why?
Does that
They have STD.
Huh?
They have STD. So
Yes,
virus. Yeah, that.
right.
But how they get it?
Oral sex.
I thought female get it and then give it to the male. No.
Well, yes. I mean, it's caused by HPV, human papillomavirus.
Yeah.
Okay? There's about 200 subtypes.
Oh.
Okay? There's more than 200. But there's a couple of them bad. And right here is number 16 and 18. That's what caused cervical carcinoma in women. Okay? All right. Now, HPV, also some of the HPV causes squamous papillomas that we're going to talk about, that we talked about last week, squamous papillomas. All right? And verrucous vulgaris.
Oh, guys.
Okay, but those are low virulent type. But the high virulent ones are 16 and 18. Okay? So, most people get one of these HPVs early in life. Most everybody does. If you say, well, I never had HPV. Yeah, most of us have. Even in newborns have it. Okay? But what happens, because of our immune system, most people get rid of that virus in 18 months to 2 years. We get rid of it, and we're through with it, and we have an immunity to it. All right? But a small percent of people, for some reason, don't get rid of this virus. All right?
Yes.
And that virus stays latent for years and years and years. And then that virus causes, if you talk about the oral cavity, it causes oral cancer. But it's a special type of oral cancer. It's not the oral cancer normally in the mouth. It's an oral cancer. It's in the base of the tongue and the tonsillar area. A totally different type of squamous cell carcinoma. All right? And, okay, and so so the fastest rise in oral cancer right now is in young men who didn't smoke. But there is some relation to marijuana also. All right? So why then are more men being affected than women? Now, how can you pass the virus from one person to the other? You can have it from oral genital sex is one. You can have it from kissing. Okay? Just kissing another person, you can pass it on. Okay? Some newborns get it being born, going through the birth canal. Okay? Right? So, but why then why are the men getting the cancer more than the women? When you think that one out. Why aren't women getting this cancer? Not that they don't,
Okay.
but it's more men.
And you're giving us the reasons why, right? And so now you want us to tell you, like, why are men getting it more?
Yes.
Is it because there's more, I don't know, the only thing that's popping up in my head is, like, more gay men. There's more gay men now. I don't know.
I mean, you're thinking good.
Yeah, because I
And then
mean, like,
kiss
now
everyone.
it's, like, something normal to be, like, gay, you know? So that's what I'm thinking.
Okay. Actually, and I just read this the other day. I've been
Uh-huh.
wondering that. I've been doing research. Because someone will suggest to you guys, which would be a good review for you.
Uh-huh.
1 month from now, I'm giving a CE here at school on a Sunday. I don't know if you knew that or not. An all-day CE. The whole thing is on oral path, reviewing the whole thing. It would be wise for you guys to attend that all day long,
Okay.
if you have a Sunday. Because I'm just reviewing oral path.
Wait, what day is it on?
Huh?
What day?
The 17th of, okay, and you guys can sign up for it.
17 on
November.
Students,
November?
yes, students can sign up for it, and just like the doctors, you have to pay, I mean, normal tuition is like $200, but you can pay $20. Students and faculty can go to it for 20, there'll be about 150 people there, but you guys could go. So you're getting a whole review of oral path, you're gonna see all these slides again, so it'll be a good review for you. It will help you
Yes.
before you take the final
Yeah.
from Susan. When is she gonna give you that final?
Oh, I think it was
December 12th, I think.
Yeah.
Yeah.
When?
It's December 12th.
Oh, okay, so this will be right before that. So, but anyway, how'd I get on that? Okay, but so that's why I'm doing the research, because I'm gonna go through it. But here's the reason I read. Okay, so what happens, and it really makes sense, I've always wondered why you see this in men, not so much because of that. Because when females, and usually it's, in most cases, passed from oral to genital sex, but when females get the virus, it's in the vagina, so they get it on mucosa, the virus. So because of that, they build up a stronger immunity. Whereas the male, the virus is on the skin, on the penis, so they don't build up a strong immunity. Does that make sense? That finally makes sense. So that's why, because when you build up the immunity, you get rid of the virus, and it doesn't stay latent. So on the males, they don't build up the immunity like the females do. All right? So, okay, and so they have it. So let me tell you a story that I'm going to tell in that thing. So a year and a half ago, my brother phoned me. He says, I was diagnosed, he said, I've had a bump on the side of my neck for a couple of months, a big size of a lemon,
Oh.
okay? And he called me, and he said, I just had they did a needle biopsy, and he said it's squamous cell carcinoma. So he has oral cancer. He was a smoker, a drinker, but he's 62, okay?
He was or wasn't?
He was.
He
Okay.
was.
Okay, well, yeah, he was, when he was young, he was, smoked marijuana and everything. I didn't, but he did.
Siblings are so different.
Yes, right.
Yeah.
Okay, so he actually, and he lives in Oregon, so he went up to Oregon to the medical center, and he went to see an oncologist, and they said, hey, you need to go through radiation. So he had stage 4 oral cancer. I mean,
Oh, wow.
the node was a metastatic node. From the primary was in the tonsillar area, okay, base of his tongue.
Yes.
All right. So when he's in this waiting room, somehow he had to sit there for several hours. He saw all these people come out who had oral cancer, half the face missing, and some guy said to him, "Man, don't go through this." So he decided he wasn't going to go through the treatment. So even though I'm an oral pathologist, I'm his brother, I said, hey, you need to. So what he did, but I never found this out till afterwards, he went to Mexico for treatment.
Okay.
And yes, and wouldn't tell me. He said, oh yeah, I'm being treated. But he was being treated homeopathic. You know, you take certain vitamins and all that stuff. Because you can get on the computer and these people say, hey, we'll cure your cancer, right? Yeah, we'll guarantee it. Well, he went to Mexico thinking he was getting cured. Well, finally, he lost his voice. He lost his voice, he couldn't talk anymore because that mass in his throat was growing so much fast. Finally, after 7 months down in after 7 months, he couldn't talk anymore. They told him, hey, you need to, this is growing so fast, we can't help you anymore. Well, they never helped him to start with.
Yeah.
But how stupid of him to do that. He thought, you know, you believe what you read on the internet, right?
No,
Yeah.
they're not.
And I told him, I said, I asked him, are you seeing a physician? Oh, yes. He never gave me really good answers. Something was fishy. And I said, well, he said, well, they're going to cure my cancer. How do you know? They said they're going to cure it. I said, if they could cure your cancer, he's in stage 4, okay? Only about 20% of the people survive. I said, if they could, if whoever you're seeing can cure your cancer, there would be a line of people all around the block waiting to get in, right?
Yes.
Yeah.
Yes. Okay? Yeah, but it still didn't ring a bell to him. So finally, he came back, he finally decided to have radiation. All right?
Yes.
So he went from 200 pounds to 120.
Wow.
And he had to be fed through a GI feeding tube for 3 months.
Wow.
So is he alive or dead?
Dead, I think.
Huh?
He's dead?
He should be.
He's alive?
Why?
Because he realized that he's messed up and came back and did
He made
radiation and
his-
treatment.
Immunity?
When you got a metastatic tumor on the side of your nose and you got a lesion as big as he did, even with radiation, only 20 people survive it. 20% of the people survive.
Yeah.
He's back to work full time, 40 hours a week, and he's after a year and a half. They say we don't see any cancer anymore.
So immune system. Yeah? No.
The what?
Immune system?
Well, that's helped some.
What did he do?
You know, he works at Amazon right now. That's a big Amazon case. Yeah. So why is he alive?
Because his big brother helped him.
I didn't help him. He didn't listen to him.
I'm not sure.
Maybe genetics.
Here's the reason. Oral cancer caused by HPV
Mm-hmm.
has an 80 to 90% cure rate. It acts totally different. Totally different. So this type of cancer in these young males. Now, my brother's a little older than normal, the people that get it. Usually they're 40 years of age, all right? So he's one of these small percent of the people that had this latent HPV virus that stayed with them for years. Okay? But they, and in fact, I even told them originally, I said, did you ask your oncologist and say, hey, is this an HPV type of cancer? And they said, no. I said, come on, I know it's gotta be. Well, finally, his last checkup a couple months, his physician came back and said, yeah, it was HPV type of cancer. Finally said that. Well, that's the only reason he survived. He's only alive because of HPV. So that's a whole different type of cancer. Totally different. And that's what people should know about nowadays. See? So we're going to get into that and talk about this type of cancer. But, you know, it's you know, and the cure rate for oral cancer is around 50%. You know. So, anyway, good story. Oh, we're still doing well. But I would suggest you guys, and you're going to see these same slides. You know, it's a good review. Now that you had this, it would be a good review for you. We're still going to have a session after that, but it's coming up. So here's a young guy, 24 years of age, who is a heavy smoker. So remember, squamous cell carcinoma, what are the clinical features that squamous cell carcinoma can be? It can be what?
White.
White,
Red.
red,
A mass.
what?
Could it have
Mass,
a mass?
papillary.
Yeah.
What else? White, red, papillary,
So,
ulcerated,
yeah.
okay? All right? Where can it occur in an oral cavity? Where's the most common area?
Or,
Lateral
Floor of
border
the
of the
mouth.
tongue.
oh,
Don't get that confused. Why you said floor of the mouth, when you have dysplasia, when you have a white area in the mouth, that's the highest percentage of dysplasia is floor of the mouth.
okay.
But the most common area, now if you include the lips in that, then the most common area, if you include the lips as part of the oral cavity, most common area of cancer is the lips. Okay? All right? So, but you can have it anywhere. And it says here, prognosis 50% 5-year survival rate. What does 5-year survival rate mean? It means that only 50% of the people are alive after 5 years.
Mm-hmm.
All right? So most of this, now this guy here was 24 years of age. And that's very young for somebody. Usually you think of a cancer as an older person who's a smoker.
Yeah.
See? So what does cancer feel like, look like? All right? It could be white, red and white. We talked about ulcerated, papillary, indurated. So this was a question on national boards. I used to review dental hygiene national board.
Yeah.
One was when you have a lymph node, like my brother, that was a lymph node. It was metastatic from the main lesion, which was in his throat. So squamous cell carcinoma metastasis through the lymph system.
Mm-hmm.
Epithelial lesions, squamous cell. A sarcoma metastasis through blood. But squamous cell carcinomas metastasis through the lymph. So we have all our lymph nodes here, right?
Mhm.
They teach you to
Yes,
palpate the lymph
palpated,
node. Okay.
yes.
So he had this big lymph node. And his lymph node has gone down to nothing.
Mm-hmm.
So he went through, and I saw how big it was, because when he had radiation, they make you a mask, all right, that you have to wear every time. It's got to hold your head in the exact location, all right? And each time they do the radiation, so that they hit the areas. And now, on his mask that he has, you can see this big bulge on the side. That was his lymph node.
Mhm.
And now that lymph node is gone. And here's how stupid, I'll tell you. My sister went to see him recently, you know, and went up to Oregon, and she said, "Oh, the node's gone too." And his wife said, "Yeah, that's because the medicine I put on it. That's what made it go away." Bullshit. Okay.
Meta what?
Medicine.
Oh,
Medicine.
medicine.
Yes,
Oh,
he
God,
put
medicine.
medicine.
Yeah,
Oh,
part of
okay.
this homeopathic stuff.
Yeah.
That had nothing to do with it. Yeah. And see what people that aren't educated will believe? Yeah. It went down because of radiation,
Radiation.
not what she was putting on it. She still believes that she cured it for putting this stuff that she got from Mexico to put on it. Yeah. Stupid. And I told her so she doesn't talk to me anymore.
Oh.
Okay, so oral carcinoma is just what I told you, Brian. Oral carcinoma metastasized to regional lymph nodes. Okay?
Mhm.
Now, more men than women have oral cancer because more men smoked. Okay?
Yeah.
So non-keratinized, now this is the same thing that's on that thumb drive. Okay?
Oh, okay.
So you're going to get this on the thumb drive.
Mhm.
Most oral cancers are linked to smoking, but nowadays it's changing. Most oral cancers are related to HPV. Okay? So it's changing.
So that's kind of good. It's better.
It's better
It's
because it's
better.
got a good cure rate.
Yeah.
Cure, yes.
I mean,
Yeah.
my brother's back working 40 hours a week,
I know, it's great.
and he should be dead. I thought he was going to die.
Oh,
Yeah. I can't believe he'd go to Mexico.
yeah.
Yeah.
That is crazy.
Yeah.
How long ago?
But he went about a year and a half ago.
Oh, wow. Recent.
Wow, recently.
So-
Yeah.
He wouldn't tell me that. He was going to Mexico down for treatment, but he wouldn't tell me that. Yeah.
Wow.
Anyway, risk factors, tobacco, alcohol, nutrition. And one risk factor we talked about is HPV.
Mhm.
So that should you guys should be taught. And sites of occurrence anywhere, okay?
Yeah.
So the microscopic diagnosis, first diagnosis, oh, this is a white lesion, all right. Transform. Okay, here's the 5-year survival rates. See, now it went from 53 to 63 over about 20 years. And if you guys do decide to go to that CE, I'll tell you how to sign up for it.
Okay.
Mhm.
But it would be worth your while.
Mhm.
So here's a couple oral cancers, okay? This is the same guy. Well, here's a lesion, a big lesion here. That's squamous cell carcinoma. And the same patient had these other areas, dysplasia. That'd be speckled leukoplakia. Now, this is an interesting picture. This is on here too. This is why you can't, here's a picture of a guy. This is why you can't spread anything around.
Give it
to
to
the
someone,
leader.
yeah.
All right. This is a patient in the clinic. This student did a full exam on this guy. Full exam. Called me over to check everything off. After he took x-rays, did all the charting and everything, okay? So when I walked up to the cubicle, I asked the student, how long has he had that lesion on his lip? The student said, what lesion? So now this student has climbed over these lips for at least 4 hours, right? Right? And never saw that lesion. So what was he doing? He was looking at teeth, right?
Yes.
He totally missed that, all right? He missed that ulceration on the lip. Now, as far as the lip, as far as the 5-year prognosis on the lip, you have a 90% 5-year cure rate. So if I'm going to have cancer anywhere in my mouth, give it to me on the lip, because you have a pretty good cure rate. Where the poor cure rates are lateral border of the tongue, floor of the mouth, and soft palate. Yeah. So here's another guy. I mean, this guy on the left. He had a sore on there for, what did he say? Now I've forgotten. A year and never had it taken care of.
Wow.
And this other guy on the right, he's an older guy that came in. He had that ulcer for 6 months. Has never healed. So you know it's squamous cell carcinoma. Okay? So you just know it looking at it. Here's a guy on the left-hand side. Look at his lip. You know that's squamous cell carcinoma.
Oh yeah.
He came in here. He refused a biopsy.
What?
As long as you don't have a biopsy, it's not malignant, right?
No one knows what it is.
Right.
Yeah.
I mean, if you don't get a biopsy, it's never proven it's malignant, but you know it
Yes.
is.
Yeah.
But to him, it's not.
Wait, why did he not want a biopsy?
I think they're afraid.
Afraid
They don't
to
want to
know?
hear that they got a cancer.
They don't want to hear that they have a cancer.
Yeah.
Right.
It's hard to get it.
Hard to accept that.
Yeah. It's,
And here it is in the palate on the right-hand side. You don't usually get it that. I mean, that just looks like trauma. My cousin's wife went to the dentist, saw a small erythroplakia, lingual to tooth number 14. Didn't think much of it. Said, come back a couple weeks, we'll check it. All right. Came back, it was still there. He never thought much of it. Said, you know what? Let's just do a biopsy of it. She never smoked, never drank. It was squamous cell carcinoma. It saved her life. And he had no idea it was squamous cell. Yeah.
Can I ask a question? So I had a patient in the morning, and he had something on a palate, and that was the patch, like 1 centimeter,
Yes.
and it has lots of dirt around it. I thought it's herpetic something, but Dr. Jules mentioned it's burning. So I didn't know burning gonna cause dirt around some patch. I thought burning gonna be a patch. And
Burning, sometimes when you get burnt,
yeah, I didn't know.
it can be a white area before it sloughs off.
No,
but
that was all red. That was no white.
Oh, there's no red. It was
No,
all red?
That was all red.
Could be burning. It could have burning. Yeah, that's a possibility.
I asked him, he said,
Does Dr. Joel work in hygiene?
Yeah.
Yeah,
she's a
nice.
doctor that she
She's a-
approved
yeah.
everything.
She's a nice gal. Really nice gal.
Yes, yes, she's so nice.
Yes. Her husband's a dentist too.
Yeah.
Here's a lesion on the lip. I mean, these are advanced cases, okay? Too late. I mean, this is a node, that's like a node my brother had,
Wow.
only not quite that big, and he survived. Here is a guy who came in and I saw, and it was draining out his jaw, okay? And looked into his mouth, look, I mean, when you see that, you know, he died a couple months after that. So people, when you wait too late, now here's a cancer on the lip that they radiated, look, totally healed.
Yes.
But remember, the lip has about a 90% 5-year cure rate. Here is, the one on the left here is a secretary, this is years ago, who I don't think ever smoked or drank. She's 30 years old, came in to see me, and look at that. She had just sore. She had squamous cell carcinoma at 30 years of age.
And her
Why?
teeth is nice.
Now, she had half of her tongue removed, and I saw her for years afterwards as a patient for private practice. She's still around. And The only thing when I started quit practice 3 years ago, she started to get some more leukoplakia in areas that worried me. And then this area on the right, just looking at that, you know that's squamous cell,
Squamous cell.
right? And both of these, you know, it's squamous cell. Well, actually, the one on the left is not. I thought it was looking at it, but it was not. Now, here's a case. This is an interesting case. This is on the side of the tongue. Okay, this was indurated, was hard. When you say indurated, again, that was a question on the dental hygiene state board a few years ago. You got an area that if something indurated doesn't move, you get suspicious. This was biopsy, okay, by an oral surgeon in Las Vegas. But the patient came to see me. I sent him back for the well, it came to see me and I looked at it and took this picture. And I said, hey, that's probably malignant. Because this is erythroplakia. I mean, this looks nasty, okay? Felt nasty. So she went back and had a biopsy. Later on, they called me and said, this is not malignant. I said, yes, it is. Don't tell me it's not malignant. I know it's malignant, right? Well, the biopsy said negative. I said, you go back and get a biopsy again. She did, and squamous cell carcinoma. So sometimes you can't always believe the biopsy. They biopsied in the wrong area or something. Look at this speckled leukoplakia between these implants.
Yeah.
So did they put implants in right over the squamous cell carcinoma? I don't know. You know,
Jeez.
here's a small area in right here, a squamous cell carcinoma. All right. How about the one on the right? Is that squamous cell? I remember it was.
Yes.
Here's a lady that I saw that she's got a swollen lymph node here. When I looked in her mouth, whole area was sore. The dentist for 6 months was adjusting a sore on her, thinking the denture caused it, when it was squamous cell carcinoma. So she died 2 months after that.
Oh.
Well, here's a good picture. This is interesting because this patient, not from here, came in, not to school, somewhere else. We're looking at the palate, okay? So we got leukoplakia. So what area looks bad in here that you would worry about? That area there.
Yeah.
So 5 years later, he came in. And now look at that area that you looked at. So areas that are speckled leukoplakia, now that's an outright squamous cell carcinoma on that same patient. See that?
Yeah.
From there to there. All right? And a lot of times the teeth just sit there and they're sitting around in the breeze, all right? You would worry about it, and squamous cell carcinoma can invade into the bone too. Here's lymph nodes. Look at the lymph nodes that are swollen up.
Yeah.
Squamous cell carcinoma presumed to be a benign leukoplakia. Squamous cell carcinoma presumed to be inflammation. Squamous cell carcinoma presumed to be a denture trauma. Squamous cell carcinoma presumed to be an abscess ulcer. You see that ulcer in the floor of the mouth? This is my best picture of a malignancy. I say, why? Because sometimes I didn't take a picture and I wasn't worried about it, but yet it still ended up being malignancy and I should have taken a picture. All right, so there's more stuff you can read on the thing. So let's look at verrucous carcinoma. Okay, the last two things, and then we'll do pigmented lesions. So go to verrucous carcinoma, it's the only ones we haven't done. We did squamous cell, so you can read all your notes there. Okay, verrucous carcinoma is not a common thing. It used to be called snuff dippers carcinoma, and it used to be about many of the cases is where people held snuff in a vestibule for years. But verrucous means finger-like, and it is a carcinoma that grows exophytic. It grows more up into the surface. It does invade, okay, but it grows. So this is a classic picture of verrucous carcinoma. You know it's a carcinoma. So one really difference, here's the difference about a verrucous carcinoma. It is a carcinoma. It's a squamous cell carcinoma, but it's a type. It's exophytic, okay? But it's a carcinoma. It does invade, but it doesn't usually metastasize. So it has a good, better prognosis, all right? And when you read your things here, it says accounts for 5% of all intraoral squamous cell carcinomas, usually seen in elderly patients, strictly men older than 55, and 20% are seen in non-smokers. Usually it's in smokers. Etiology, striking association with chewing tobacco or snuff that held it in that area. So years ago in the South, it wasn't nice, and many years ago, back in the 20s, 30s, and 40s, okay? It wasn't nice for women to smoke. Women didn't smoke, all right? So how did they get their nicotine? They chewed tobacco. Right. And so many years later, these women ended up with verrucous carcinoma. There's a lot of case reports of that, okay? So it says here, slow growing exophytic. Exophytic, Sadie, means above the surface. Term you should be aware of. And it's often papillary, irregular surface. Lesion has rugged, like deep folds. Usually, and it usually occurs in the vestibule or on the gingiva, okay?
And that's where they would usually put this.
Right where they put the stuff.
Okay.
But not 100% is not always related to chewing tobacco.
Oh.
It can be usually in a smoker, but a lot of it. That's why they used to call it snuff dippers carcinoma. And then on page 12, here on D, it says usually does not metastasize. Outline it.
Okay.
So most carcinomas do, but page 12, top of the page on 12. Sadie, are you on page 12?
I'm on 11.
Turn to 12.
Oh,
Right top of the page.
yes.
Does it say usually does not metastasize?
Yeah.
Yeah.
Okay. Or do you have different notes?
I wrote on it, so
Oh, okay.
my pages is different.
Oh, your page is different.
Yes.
Oh, okay. All right. All right. So treatment, surgical excision, and it has an excellent prognosis, very little metastasis rate. 5-year survival is 90%. Okay, so
Okay.
it has a good survival rate
So.
because it doesn't metastasize.
Oh, I see. Okay.
Yeah,
So if it doesn't metastasize,
it
is
has a better
better
prognosis.
prognosis? Is
Right.
it still malignant though?
Still malignant.
Oh.
Yep. But usually metastasis is a very characteristic of a malignancy, but there's a couple that don't. Now it can, but it's not very common. So that's why it has a good 5-year survival. So let's look at another picture. Here's a couple more. I mean, look at here. See this? Papillary. You know.
Yeah.
So just remember, verrucous is not common, but verrucous means finger-like, finger-like, finger-like.
Yeah.
And here's verrucous going around the tooth. You see these little finger-like projections.
Yeah.
This was an unusual case. So it's a low-grade variant of oral squamous cell carcinoma. Some lesions occur in areas where smokeless tobacco was habitually placed. Average age 55. Lesions are exophytic, slow-growing. It's a very slow-growing malignancy. It's not fast, and usually does not metastasize. All right, good. Okay. Now let's talk about basal cell. Basal cell is the most common skin cancer there is. All right. It usually occurs in areas that are exposed to sun. The more light complected you are, the more chance you're going to have. And if you get a blonde, blue-eyed gal out in the sun all the time, when she gets older, she's probably going to have a basal cell, all right? And the most common area for basal cells is the middle part of the face, all right? The darker complected you are, the less likely you're going to have a basal cell. Basal cell says the most common type of skin cancer, accounts for 80% of all skin cancers, 800,000 new cases a year, usually seen 4th decade. Fair skinned, blue-eyed individuals, more common those who work outdoors, related to the sun. Caused by damage from sun exposure. Okay, there is a syndrome, don't worry about it. usually middle third of the face, like I just said. Early stage appears as an elevated macule or papule, and it has rolled borders. And I'll show you what I mean by the rolled borders. Here's a guy who was an employee of the dental school. He ran around all the time and had this on his forehead. I kept saying, "What are you doing about it?" "Oh, I'm putting lotion on it, getting rid of it." I keep seeing it. I said, "You need to have that taken off." "Oh no, it's healing." You know, after a couple of months, it said, "Go in and get that thing biopsy." Well, it came back to basal cell, classic basal cell.
Hmm.
You know what the old term for basal cell is? Rodent ulcer.
Hmm.
What is a rodent?
Means it's not good anymore.
No, what's a rodent? It's a
little-
rat.
Yeah.
Oh, it means
Yeah.
rat.
So if you took an old path book from way back in the 20s,
Mm-hmm.
it called it a rodent ulcer, because they used to think what caused these was when you were sleeping at night, the rats came out of the walls and were chewing them. That's why they call it a rodent ulcer.
Is that
Wow.
what they really thought?
Yes, that's what they really
Oh,
thought.
okay.
That's where the name came from.
How would you not notice a rat?
Yeah,
That's so
right.
weird.
Chewing.
Just
Yeah.
forehead.
Yeah.
So this is classic of a basal cell carcinoma. Right here. If you show me that, I'm going to say basal cell.
This is-
Because often they have rolled borders, and the rolled borders is because you got proliferation of that epithelium.
Mhm.
It's a basal part of the epithelium. It's still squamous cells, but the basal part, that's what they call it, basal cell carcinoma. Now, so often it gets a little scaly in the middle and they bleed, but often they'll just start as an elevated papule. But that's classic for it. Both of these are classic of a basal cell, slow growing. Now, can that be a squamous cell? Could these
Yeah.
be a basal cell, a squamous cell?
It could be.
Yes, it could be. So if I ask you for a differential diagnosis, give me two things it could be, basal cell or squamous cell.
Yeah.
But it's more classic of a basal cell. All right? They're slow growing. All right? Now, here's the other characteristic of a basal cell. It does not metastasize. All right? Now, just because I said it doesn't metastasize, does it invade?
Yeah. Yeah.
Yes,
Because it's still cancer, right?
it's still cancer,
Yeah.
so it still invades.
Mhm.
So if you don't treat these, then what can happen? Well, here's one on the, here's one actually on a female around her eye, so she has to have a skin graft, okay? So if you don't treat them, they do invade. Yeah,
Oh
Wow.
my gosh, that's
Yeah.
half a face.
yeah, right, so you gotta take care of them early. Here's a nose that was lost, here's another basal cell, all right? All right, and metastatic you guys didn't talk about, okay. All right, so here is two cancers that don't usually invade, verrucous carcinoma and basal cell.
Mm.
But just because it doesn't invade, it still will, and it doesn't usually metastasize,
Right.
but it still invades.
Okay.
I was getting the opposite,
Okay.
all right? All right.
So when it invades, it would destroy tissue. Or-
Yes.
Okay.
Yeah, yep, you get an ulcer and things like that. Okay, so now we gotta go through pigmented lesions. And that's pretty easy, there's not too many. Let's see if I can find her.
Use the
All right.
restroom.
Is that okay?
What?
We go?
Yeah, sure. You will come back though, right?
Yeah.
Yes, yeah.
Okay.
Thank you.
Is this getting to be test week for you guys, the midterm?
Yeah, next week.
Next
We have
week is-
2 midterms. One for Miss Hayden's class, and
Who?
then
Hayden?
Miss Hayden, yeah.
What is-
Shelly Hayden.
Oh, Shelley.
Yeah.
What does she teach?
So she teaches hygiene topics.
Oh, okay.
So it's just
But Shelley, what was her name? Do I have?
Shelly Hayden.
Oh, Shelley. Oh, Hayden. Okay.
Yeah,
Yeah,
I don't
Shelley.
know what her maiden.
No,
is.
I know
Yeah.
who she is. There's another Shelley too,
Oh,
right?
there is.
Yeah.
Oh,
Yeah, there's another Shelley. Isn't there in hygiene?
Miss Withers.
Yes.
What's
Yes.
her first name? Is it Shelly as well?
Isn't it Shelley too?
I think it might be.
Yes, I think it is. Yeah, Shelley Hayes, nice gal.
Mhm. So we have a midterm for her class, and then another one for Perio.
Who teaches that? Periodontist?
Yeah, but I'm not sure what her name is. She's new.
Oh, okay.
Yeah.
But she's from the perio department,
Mhm.
not the hygiene
Yeah.
department.
Mhm. Yeah. We could, yeah. When do you drive back north?
You know, I go up Sunday.
Sunday?
Yeah.
Yeah.
Yeah, so it's a 14-hour drive.
Wait, so what freeway do you take?
You know, I go up Interstate 5,
Okay.
and then I cut through Vallejo and go to near Santa Rosa.
Uh-huh. Oh, okay. So you take the
I take
5.
5.
Okay.
And you're from
Santa Fe.
Santa Fe.
Yeah, I'm from there.
So I don't go through Santa Fe because I come out at what is the town below Santa Rosa? Oh, come on, between Santa Rosa and
Petaluma.
Huh?
Petaluma?
Petaluma.
Yeah.
I cut over Petaluma.
Mhm. Yeah.
Put some water real quick.
So how often do you get home?
Last time I was home was during our summer break, but it was only for a week. So this was like maybe 2 months ago. Yeah. And then I'm going up again during Thanksgiving
Oh,
break.
Thanksgiving.
Yeah.
So I heard you guys took a whole week off?
No.
No,
No,
No.
don't think so.
just
Just
Wednesday, Thursday, and Friday?
Wednesday, Thursday,
And Friday.
and Friday.
Oh,
Yes,
we get
Friday.
Wednesday.
Yeah.
We get Wednesday off.
I think usually
No,
before,
don't think
no?
so.
I don't think we get Wednesday.
Really?
off. I don't-
Last
They
time,
always did
last
before.
year we didn't do that.
We didn't get Wednesday, huh?
No, just Thursday I think. I remember I came here and then evening when we were done. Yes, I went to Orange County.
You what?
I went to Orange County.
Oh, where do you live?
I live in Redlands right now.
Oh, Redmond.
Yes. I moved here. I did commute. That was too bad. So
Oh, yeah. You commuted from Orange County?
yes, 1.5 months. I couldn't survive, so I moved here.
That was a long drive.
Yes, especially in the morning with lots of truck. I didn't like it. I was too sleepy in the morning. Do you know when you do the comp FMX? So you give the paper to instructor to grade it.
Yeah, first you self-graded.
I did.
Okay, and then you just turn it in.
Miss Withers got it, so
Oh,
You did?
yes.
oh, then yeah.
And when I can pick it up and then put it to Miss Barbara or give it to Miss Ellington.
Yeah.
Where?
You can give it directly to Barbara, or you could put it in Miss Ellington's.
So I have to reach Miss Withers to grab it?
No,
She'll give
put
it in your mailbox. Yeah.
Oh, in my mailbox. Got
Wait,
it.
how did you give it to Miss Withers?
Miss Withers passed and then she asked, how did you do with the guy with ulceration about the FMX? And then she asked, do you want me to create it? I said, okay, thank you.
No, yeah, that's good.
Elaine is good too.
Barbara
Barbara is picky.
No, Barbara, yeah, no.
Barbara and the other short
Yeah.
hair, they're so picky. But Elaine is nice.
Yeah.
They are so good.
I'm picky too.
No.
I don't think you are.
I'm mean. Most dental students
So you
were
were
scaring me.
really?
Yeah.
I scared Dr. Richards. I scared so bad. So you were her teacher.
Yes.
So you did all that stuff that she does to us?
Yeah.
Okay, that means you.
A mean old guy.
Wait, so you had quizzes for the hygiene students?
Did I?
Yeah, or no?
Well, I taught the hygiene students when I was here.
Yeah, that's
Oh.
I taught them
Yeah.
all path.
Yeah.
Oh.
How
She
was
taught
that?
them general path part, and I did all the oral path part.
Oh.
Yeah.
Yeah, I agree with you. Dr. Grundy, she has accent like me.
Oh.
So since I'm talking, some people, they don't understand because of my accent. Dr. Grundy, she's from India.
Right.
She has accent.
But people don't have a hard time understanding it, do they?
Not really.
Not too bad.
Not too bad. No.
No.
Yeah, I talked to her today. Seems like a nice gal.
Yes, she's so
No,
nice.
really, yeah.
Yeah.
She's nice.
Yeah.
She get upset or mad so fast, but she's nice.
Did his wife?
Upset, mad. Mad means calm down, no talking. If someone talks,
Oh.
she get upset. Like on a class, you remember in the morning?
Yeah.
She get upset so fast.
You know what I did once at dental students because they would talk. I was kind of strict in class. You know, I like to have fun, but I'm
Oh.
strict too. But you know, there was talking going on when they're lecturing.
Yeah.
Oh yeah.
Yeah.
They are so.
You know, so what I did, I brought a radio one time with a cassette player,
Mhm.
and so I handed out a quiz. And when they started, I turned the cassette on, and they got really pissed off. I said, "What are you mad about?" "Oh, we want it silent." Why? I said, "Well, this is what you guys do to me. I have to lecture in this noise, so you guys can take a quiz and do this."
You're so funny. Oh my goodness.
Don't you think that?
If I ever become a professor, I would do that.
Yeah.
Just to like,
I mean,
you should have done that in the beginning
That-
from each class.
that
like,
got my point
you guys
across.
don't like this, so don't do it in my class.
Yeah.
Oh my
Yeah.
god, that's so
Yeah,
funny.
and they were mad at me. I said, "Why are you mad at me?" "Well,
Kids.
you made this up. Well, look what you do to me. You expect me to get up here and lecture,
Oh my
and
God.
and you're talking the whole time?"
That is so funny.
I
That's
just,
actually really funny.
yeah. Another thing I had fun one time. This was years ago, but there used to be. He was in my department, so there was an instructor behind me that lectured. I had the same group. Well, there used to be some things up front in the floor you could open up, and they had I guess they had electrical plug, right down on the top, So I had heard, when I was lecturing, I heard this, "Gurk up, gurk up." Well, there was a cricket in it.
Oh my gosh.
So I took the microphone and put the microphone in opened this little area in the floor, and I put the microphone in there, okay? And closed the top, it had a lid on it. And so when he started lecturing, here's this cricket came over all the loudspeakers in the room. It took him, it took
Oh my
him,
God.
it took him about 15 minutes before they could figure where this cricket was coming on the microphone. Finally, they looked in the floor and found that I had stuck the portable mic in there.
That is so funny.
Yeah. That was
You're
one of
mad.
that's one of my favorite things. That was so great.
You're very
Yeah.
naughty one. That is cool.
Yeah. Okay, we're gonna go through pigmented, pretty easy,
Okay.
and she's not giving you a lot of them. So most pigmented lesions arise from pathologic changes of oral epithelium. That makes sense. Okay. Some pigmented lesions arise from pathologic changes in the submucosa. Okay, so they can come from the epithelium or the connective tissue. Causes the lesion to arise from a melanocyte. Melanocytes are what? Give us our, when we get a suntan, with darker complexion, it's the melanocytes that develop that. So you can have developmental anomalies. If you have a developmental anomaly of normal tissue, it's called a hamartoma. So, response to local factors. So, you can have response to local or chemical factors. So you had this on your quiz. If somebody smokes, that heat and the chemical factor causes a smoker's melanosis, right?
Yes.
All right. And these, some of the melanocytes can transform into a carcinogen. In other words, it can become cancer. Some pigmented lesions are due to implantation of exogenous. Exogenous means from the outside. So what is an example of an exogenous pigment that can cause pigmentation? Amalgam tattoo, right? So, etiology of pigmented lesions, developmental anomalies would be a melanocyte nevus, physiologic pigmentation, okay? Physical and chemical irritation. You can have, you see the melanotic macule you see on young women, usually on the lip or gingiva. You can have smoker melanosis, or you can have transformation of a melanocyte into a melanoma, okay? Should be called malignant melanoma. Melanoma is a funny name because it should be called what? Melanoma is anything that ends in OMA means a neoplasm, but it means a benign neoplasm. But this is not benign. So instead of melanoma, it should be called what?
Malignant.
Should be, well, we call it malignant melanoma sometimes,
Okay.
but it should be called a melocarcinoma. Does that make sense? Because it is a carcinoma.
So why haven't they changed?
I don't know. You know, I mean, if you just look at the name, it has the characteristic of benign lesion, but it's not.
Yeah.
You know, like fibroma, lipoma, they're all benign. Some pigmented lesions arise from pathologic changes of mucosa. Okay, amalgam tattoo, a melanotic nevi, those come down into connective tissue. Some pigmented lesions arise from pathologic metabolic conditions, Addison's disease. We're going to talk about that a little bit. So pigmentations can be flat, they can be elevated, usually smooth, often have a well-defined or diffuse border. Okay, they're brown to black, maybe pink or red. I don't know what's pink. Papule. Yeah, I'm not. They can be ulcerated or indurated, just like their squamous cell carcinoma. Oh, all right. Why is this in here?
Wow, that looks nasty.
Okay, so the Y on the left-hand side, what would you think just looking at the picture?
For sure, melanoma.
Yeah, for sure,
Cancer.
melanoma. What is the right side?
We had that one.
Yeah, you have it.
Yeah.
The white one that is like a finger. And
Yeah,
then
that's
the-
right.
Verruca.
Verrucous carcinoma.
Verrucous
So what's she
carcinoma.
gonna say here? Melanoma, verrucous carcinoma,
Yep.
okay? The one on the left, hey, my finger again. My finger right there,
Wow.
Again.
okay? This was, what do you think of that lesion on the left?
It's
Elevated,
Yeah.
nasty looking?
Yeah, it's carcinoma.
not ulcerated.
It's not
But it's
carcinoma.
It's probably could be, maybe not outright, it could be ulcerated in some
Squamous
minor areas.
cell carcinoma? No.
What?
Squamous cell
Yeah.
carcinoma.
I would think. You all agree?
Yeah.
Let's look at her answer. Squamous cell carcinoma.
Uh-huh.
What do you think on the right-hand side one?
I don't know.
Squamous cell carcinoma again?
Could be, but it's dark, it's pigmented.
Oh, okay.
Yeah.
Then it would be melanoma.
You're right. And see, she's using the word malignant melanoma. We use the word malignant because anything that ends in OMA usually means benign. So that's why melanoma by itself is not a good name.
Yeah.
So that's why it should be malignant melanoma. Lesions without obvious mass. Okay, what do we mean by that? What is the lesion that we have on our skin that doesn't have mass to it? Give me an example of a pigmented lesion.
That doesn't have a mass.
Yeah,
Macule.
macule, okay.
Amalgam tattoo.
Amalgam tattoo doesn't have a, well, it has a mass down in the connective tissue.
Okay.
Yeah, but it's not really a mass, it's just little tiny particles.
Okay.
Give me another example. And you got them on your skin.
Oh, a mole.
Mole, or, yes, or a
Yeah.
freckle.
A freckle.
A freckle. But a mole is usually elevated. So a mole would have a mass.
Mhm.
A freckle would not.
Okay.
Melanic macule would not. Okay? So let's look at some. Here is on the left hand side. Now he's got pigmentation somewhat equally all over. And look, he's got it everywhere, somewhat symmetrical. So would you worry about that being a melanoma? They got symmetrical on both sides?
Yes.
No.
No, you wouldn't worry. If it's symmetrical?
Oh,
Yeah.
okay.
Okay.
No. So what do you think the diagnosis is?
Physiologic
Yes,
pigmentation.
physiologic pigmentation. What do you think on the right side? Let's say this person was actually losing weight, was tired, and they never had this pigmentation before.
Addison.
Addison's disease, good, right? So let's see if you're right. Physiologic pigmentation, like Brian said, and Heidi said, Addison's disease,
Yep.
all right?
Does the bronzing only happen on the gingiva?
It could happen in other areas. The other areas that you chew that could be irritated could be the buccal mucosa, right along the occlusal line.
Okay.
But somehow, when they're irritated, it stimulates the melanocytes.
Yeah.
To produce, yeah.
Okay.
Okay, here's another one. On the
Oh, we had
left-hand
that.
side.
That
On a
was
quiz. Yeah.
Yes,
Mm-hmm.
There was a
and
smoker.
he said it's a smoker.
Yeah.
But it could be, also could be, you can also get a melanosis from biting also. But this would be a smoker's melanosis.
Mm.
And if you quit smoking, after a while, it goes away. So let's see if you're right.
Yep.
Smoker's melanosis, good.
Mm-hmm.
So how about on the right side?
Does that looks like amalgam, or no?
Nah,
No.
But there's no amalgam around those
Around
teeth,
it.
and you don't
Yeah.
have crowns on.
That's true.
Usually you're gonna see a crown
Yeah.
related to that.
So I'm guessing.
It's not carcinoma. It's malignant.
Not
that
it's not character, it's just, they're not elevated,
Oh.
there's not a mass to them.
So it's not malignant. Oh, so does he smoke?
Could or could not, but look at the lips. See, dark complected or
Yeah.
light complected?
Dark.
Dark.
So we're probably looking at what?
Physiologic.
Physiologic pigmentation.
Physiologic.
So do you think that's the answer? Physiologic pigmentation.
Yeah.
Yep.
Okay, is it because it's just because of his lips? The color of
He
his
has
lips?
color on gingiva too. Like,
And
on a
yes, he has color
maxilla.
on the gingiva
Yeah.
too.
Okay.
Yeah,
On a maxilla.
yep, on the maxilla.
Okay.
Right. Dude, I don't know what she's working on that one.
Kind of looks like
Well-
stomatitis.
I would call that physiologic pigmentation too.
Wait, what
I mean,
are
I don't
you
know what the red
looking
is.
at on that one?
And you-
I've never seen that one before. I don't know if she's talking about this area.
But it looks
What
like
is this? This is where the camera is not showing that. So you can't look at this. Got some pigmentation here too. I'm gonna say, what do you guys say?
Physiologic.
I'm gonna say physiologic pigmentation. We may be wrong,
yeah.
Oh.
Physiologic. Yeah.
but that was a
Yeah,
guess. folks.
Brian.
That was a guess.
Brian got it.
So, what do you say on the right-hand side? And then there's no history here, and it's really tough without a history. I'll give you a hint. This is the same picture as,
Oh, the other one? Oh, both of them is
this is the
physiologic.
same patient.
So it's Addison?
Yes, Addison's disease. Good. Yep.
Did you take that picture?
Now, I don't remember if I did or not.
Wait, how do
Oh,
you?
it's Addison.
Without a history, that's a hard one.
Okay.
Yes.
That's really hard. It really is. You gotta have a history on this.
Uh-huh.
Okay, here's a one, on the left-hand side, a young person, female, often they're young females, they'll actually have this pigmentation, usually about 20 years of age, and they're usually not bigger than a centimeter.
Acquired? No.
Yeah, acquired. It's acquired.
It's acquired?
Yes.
That's what I'm thinking. Acquired
Melanotic macula. Right.
macula. Or,
You agree?
I think,
Yes.
They can be on the
Yeah.
list too,
yeah.
Mm,
right?
So you should
So you agree? Would you vote on it?
I agree.
Yeah.
This is oral.
If you're wrong, will you wash my car next week?
Yeah, we'll take it to the
You can take it-
$5
$5 car
car
wash?
Right across the street.
Okay, so melanotic macula, right?
Yes.
I know it was a gal was about 20 something.
Oh.
Melanotic macula. Okay, how about the right hand side? There's some things in there you should look at that really help you.
The crown?
The crowns, you should look at the crowns.
Oh, it's amalgam tattoo?
That's why.
Oh.
How did the amalgam get up there?
Maybe during the procedure.
What procedure?
The
Crown prep?
Wouldn't have got that high.
Crown, we don't need
Oh.
amalgam.
Maybe. it
Wouldn't have got that
was
high.
And it's anterior, so they're supposed to use a composite, not amalgam. That's anterior. So
What now?
they use composite, not amalgam,
For what?
to fix that under the crown.
Okay, but it's way high. Where is it? It's near the apices of the tooth. And what do you see right here? Scar tissue.
Yeah.
Okay.
So what did they do on this tooth? And you guys may not understand this because you don't. They did an apicoectomy.
Oh, it's
Oh.
on the apex.
So they went up to the apex, cut it off, and they filled it from the apex. Years ago, they used to fill them with amalgam.
Okay.
Oh wow.
They don't do that anymore. Now they use some other stuff to
Mhm.
seal them.
Mhm.
Used to, so amalgam got into the tissue.
Mm.
So with that scar tissue and being way up here and not right here, but up there, see, you wouldn't understand. Now if you saw this again, you would know.
Yeah.
So are you voting on
Amalgam
amalgam
tattoo.
tattoo?
Oh.
Yeah.
Okay.
Do they still do that procedure today?
No,
No.
they do
It's
apicoectomies,
macule too.
Oh.
but they don't do film with amalgam anymore.
Mm.
Used to see that a lot, but not anymore. Okay, how about the left side?
Oh yeah.
Melanotic macula.
Yeah.
Yep. And all the information is here for you guys to read. Well, here's oral macula. You can read through that.
Mhm.
And you don't have these pictures, but you have my picture. You have,
Yes.
Bonnie read most of those pictures.
Yeah. So wait, why is it melanotic macule?
You know what? Flat.
Flat?
Been there, they have to have a history.
Okay.
Been there for a year or two, not increasing in size, not elevated.
Okay. So
All right.
it's flat. So those are okay. I just
Okay.
wanna-
And it's
Now-
is it common on the lower lip?
Yes,
Okay.
it's coming on the lower lip and the gingiva, mainly in females in their 20s.
Mhm.
Yeah, mainly in females. And you don't see it real often, but you'll see pigmentation that people have. A lot of times they want it removed, especially on females, because they've covered up a lipstick or they want it cut off. You know,
Mhm.
Now, the one on the right's not a good example, but let's go for what you said on the left, melanotic macula.
Yeah.
The right one, give me a guess. What do you think?
I think it's a mole, right?
Could be.
Okay.
Moles are not common in the mouth,
Okay.
rare in the mouth.
So it's more on the face.
They're more on the face than on the skin.
Okay.
But they do occur,
Okay.
but they're not common.
Mm.
So I like your guess,
Mhm.
and we're talking about pigmentation.
Yeah.
But my first choice, I would ask a question here, and you'll learn that after next lecture. Is this fluctuant or not? And if it was fluctuant, I would have a different diagnosis. I would say hemangioma, because it's bluish. But from what you said mole, right?
Yeah.
A nevi, moles and nevi. Okay, and I probably agree with you,
Oh.
melanotic nevus, you're right.
Yeah, because I just.
Not
it
a
looks like
typical,
mole.
not a typical picture. Okay, good. How about, I took this picture too on the left-hand side.
That was on our quiz, I think.
Yeah.
Yes.
No,
That one.
No?
Left one. Right
no,
one is on.
you had a different one on your quiz.
That was this one.
No. It was more on the buccal mucosa. And the bottom one showed some amalgam right down the bottom of those crowns. This is different.
Hmm.
So the history is what? Patient had amalgam, patient has crowns on there.
Mhm.
Now, what if those teeth never had any restorations and they were normal teeth and you had that pigmentation? Would you be thinking of amalgam tattoo? No, you
No.
wouldn't.
No.
That would be harder to make the diagnosis.
Yeah, it would
Uh-huh.
be
So
hard.
are you voting amalgam tattoo?
Yeah. 'Cause
With
of
that
the
history of
crown.
the crown?
Mhm.
And how did the amalgam get in there?
Yeah.
Because there was probably a class 5 amalgam
Mhm.
on that tooth. So when they did the prep, that diamond touched the gingival tissue and put amalgam into that gingival tissue,
Mhm.
right?
Mhm.
What do you think on the right hand side?
That one's for sure melanoma.
That was melanoma.
Yeah.
Melanoma in situ.
Inside too.
Okay, warning signs for a melanoma. A, B, C, D, and E. And this is something you should know. What are some characteristics of a melanoma? Have you ever heard of the A, B, C, D, and E thing before?
Mhm.
You have. Oh, you
Yeah.
remember that in class. A
Yeah.
is for what?
Asymmetry.
For what?
Asymmetry.
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 B is for what?
Border.
Border.
Irregular border.
Border.
Irregular.
C is for what?
Contour.
Color
Corner.
change.
Never mind.
Okay. D is for what?
Diameter. That's how
Bigger
big
than
is
what?
it?
Wow.
0.6
0.6.
centimeters or 6 millimeters.
Yeah.
E is for what? I forget. I don't know. E is for air.
Evolving.
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 E what now?
Evolving.
And what does she mean by that? It just keeps growing? I don't know. That's a new one.
The
It never used to
lesion
be there.
changes
It
with
used to be A,
time.
B, and C. So is it on our notes?
So evolving means the lesion changes with time.
Oh, okay. Yes.
She
Okay.
mentioned. I don't know.
All right. Where is it on the last page?
I
Number
added
8.
that.
Page number 8.
Where do you see it?
Experiences, movement.
Oh, I see it. Yeah, evolving. Helps different. Okay. So here, yeah. All right. So there's different types of melanomas. All right. And you can have radial growth and vertical growth. Radial growth means it's growing more out this way. Vertical growth going down. You would rather have what? Vertical
yeah.
growth. Now melanomas are common, or right now they get to be a common skin cancer, but often on the legs, light complected person, dark complected person, not so much, all right? But, you know, if you get a melanoma early, you got a pretty good chance, all right? An intraoral melanoma has a very poor prognosis, and she probably has this somewhere here. And here's another common thing. Most melanomas in the mouth, they're not common. Most melanomas in the mouth are metastatic from somewhere else. But if it's the primary, most melanomas are in the heart, are in the maxilla or hard palate. And every one we looked at was in the maxilla. Well, no, we saw one on the gingival tissue.
Maxilla and hard palate.
Yes.
Okay.
So here's a melanoma. It sure has asymmetry, right? It has an irregular border. It has color variation. Variegation? What's variegation? Is that a word? Diameter? 6 millimeters or more, or pencil size of a pencil eraser. E is evolving lesion. Lesion changes over time.
Over to
Yeah. Right? So that is so if you have a pigmented lesion on the skin, you know, you want these checked out. And melanomas are not that uncommon. When my son-in-law had melanoma on his leg, you know, he's fairly young, in his late 30s. I don't know why. You know. Here's a patient of mine. She had. Well, what would you do to treat this patient? What was the first thing you would do? How would you identify this pigment area? What's the first step you would do?
It's amalgam tattoo.
Huh?
It's amalgam tattoo.
How you know it is?
It's close to the crown.
Okay, but that doesn't prove it. How would you prove it? You could do it with a biopsy, but there's the easy way to do it, easier way.
X-ray.
X-ray. Take an X-ray. And when I took an X-ray of this patient, it showed it. And here it is. Sometimes you have to look close, but here's the amalgam. See this?
Oh, is that how it shows?
Yeah, that's how it shows.
Okay.
Yeah. And this was my own patient private practice.
Is that mental fragment? The hole down there?
Yes, yes. Yep, yep. All right. So that's an amalgam tattoo. So this one on the left-hand side, a guy had this biopsy years ago, and it was, oh, what's the term they use? Atypical melanosis. It was atypical, but then it started to grow fast, and now, look, all the signs of A, B, C, D, and E.
Yes.
He actually lost his jaw and died.
Oh,
But where are these areas? And he was a young guy in his 40s. But on the right-hand side, look at that big thing. Again, both of these are in the palate. I mean, you know that's melanoma. Both of them are melanomas. All right. Extraoral lesion. Well, you'd be suspicious of that being a melanoma, wouldn't you?
Yeah.
Mm-hmm.
Malignant melanoma. Oh, that was easy.
Is that it?
Yeah.
Yes.
Okay.
But you'll have more on that slide. I will show you. Let me run through that. How's your department chairman? She treat you good?
Our department chair?
Yeah.
Oh,
Nice gal.
Miss Friesen? Not Friesen.
Not freezing. Come on now. You don't know your department name, department chairman's name? You
Marshall?
flunk on it.
Marshall.
Miss Marshall?
Was that her name now?
Yeah.
Okay.
The department for dental
Because it used to be
hygiene?
her,
Dental hygiene? Miss
her
Marshall.
husband died.
Oh.
Oh.
Her husband?
That she was married to several years ago. He was a nice guy. He worked there.
He-
So-
Like
he
recently
worked
or?
Huh?
Recently or?
Probably about 10 years ago.
Oh.
He was working here in Yellowstone.
Oh, he was working
Yeah.
there.
And he died, so she got married again. But her name was, what's her first name?
Christy?
Christy. 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 No, now it is Marshall, but this is something else. Christy. Her husband was a really nice guy. It was sad. He died.
She was really sad, huh?
Huh? Yeah, it was sad.
Yeah.
He was a good guy.
She didn't get married again?
She got
She
married.
did.
She
She
did?
got married.
Yeah. So where's that?
Oh, the.
Yeah. No, just review that real quick for you. So this one is done, this is pigmented lesions. We're gonna do pigmented. Okay, this is by Bonnie Hermoso. She worked for me, and now she's an endodontist, teaches here a little bit with,
Uh-huh.
and so, if
Miss
she's a
Bonnie?
friend of mine, if she knew.
She's in a child session?
Pardon?
For kids? Miss Bonnie? No?
Bonnie is, she did this lecture. She's a faculty member here.
With the curly hair.
And she works in endo. She only is here. But her daughter is a freshman dental student.
Oh,
Yeah, I just talked to her earlier.
that's different Bonnie.
Okay, so here are all the ones again. There's a couple here that you didn't have. So you kind of endogenous pigmentation comes from the outside, and endogenous comes from the inside. So amalgam tattoo is a exogenous. Addison disease is endogenous. Does that make sense?
Yes.
So here's examples of endogenous, physiologic pigmentation, epithelial. Epithelial is a freckle,
Okay.
or similar to oral melanotic macule. They're very similar. You can have a pigmented cellular nevus, melanoma, malignant melanoma, Addison's disease, Pew-Chaggers. You guys, it's rare. You guys don't worry about that one. Exogenous would be smoker's melanosis. Well, the cause is from outside. Okay, foreign bodies, amalgam tattoo, plumism. You didn't get into those two either. So here's physiologic. Normal amount caused by normal amounts of melanin found in racial groups that have darker pigmentation. All right. I remember as a dental student, I was from an area where there were no black people. And I remember I had a black patient when I was one of my first patients, and I looked in the mouth, and here was all this pigmentation all over the gingiva. So I called the instructor, man, oh, something's wrong here. I said, oh, no, that's just normal pigmentation. I didn't know. So it was found in racial groups that have darker pigmentation, often found on the attached gingiva. So often there's like pigmentations on gingiva that we looked at. Usually have a history of a long duration. So if a lot of bodies has pigmentation, you want to say, how long have you had this? All right? So you're darker complected, you're semi-darker complected. So you guys would have more, and I'm Scandinavian, so you guys would have more likely, you would most likely have darker pigmentation in gingiva than any of us.
Yeah, I don't think I do.
You don't think you do, but
Yeah.
you would.
But
You're most likely
You
to.
don't have it.
Yeah.
No.
So if you saw the same pigmentation, if you and I had the same pigmentation on your gingiva, you'd worry more about me than you'd worry about you. Because yours should be natural for you, but not natural for me. Does that make sense?
Yeah.
Treatment, as long as you identify, you don't have to do anything. What would be differential diagnosis would be amalgam tattoo. But amalgam tattoo is usually a single area, where physiologic pigmentation is often in the gingiva and symmetrical. The junctional nevus, you don't find nevus in the mouth. So this is classic of a amalgam of physiologic pigmentation. Did we saw this before? No? No, I don't think so.
Yeah, we did.
Did we?
Yeah.
Or similar to it?
Yeah.
Similar to it.
So here, yeah. So this is a darker it's a black person.
Yeah.
All right. Here's another physiologic, and you can tell from the lips, he's darker complected. All right.
Would
Hey,
you-
we saw this one before.
Yeah.
That was the other side.
The one
That
with
was
the
the other
bad-
side.
But this is more normal color. That was a bad color.
Yeah.
Yes.
Yeah. Now this makes sense. That was a lousy slide on their test. Smoker's melanosis stimulates by tobacco. You stimulate it. Disappears usually 3 years after you do it. Amount of pigment appears to be related to the amount of. The more you smoke, the most likely you're going to have it. Found in 20 to 30% of the smokers. All right. More common in females on birth control because that changes the hormone thing more. Okay. Covered by intact mucosa. Anterior gingiva is where you see it because often with a cigarette. Buccal mucosa is a common area. Palate for pipe smokers. Well, that makes sense because all the heat goes to the palate. Yep. Is often diffuse, irregular. Treatment, stop smoking. So this is smoker's melanosis, and we had this, right?
Okay.
Epithelial or melanotic macule. It's a synthesis of the basal layer of melanocytes without an increase in the number of melanocytes. Not an increased number, it's stimulation of the melanocytes. So we get a freckle, which is a epithelial, oral melanotic macule, or labial melanotic macules on the lips. So they're both melanotic macules, all right? The epithelial is on a sun exposed, is a freckle, so that's related. So, you're not gonna sit there with your mouth open, so you don't really have freckles in the mouth, okay? So here's an oral melanotic macule, usually on the gingiva, or the lips, focal brown to black, usually less than 0.7 centimeters. Females, much more common than males, 2 to 1 female. Remember I said usually young females about 20 years of age, you usually see them in.
Yeah.
Usually does not enlarge after diagnosis, so they usually don't get bigger. They grow to a certain size and they stop,
This time.
okay? Yeah? Not dependent on sun exposure. So this oral melanotic macule, like a freckle depends on sun exposure. Oral melanotic macule does not. Treatment, you excise them to rule out a melanoma. Here's a differential diagnosis. Here's typical, all right?
Maybe.
Here's another one. This is not my patient. I took that picture. You don't even need the arrow. You find it. You got the arrow. All right. And she was a young, not a really young female, but
Oh wow.
yeah, this is okay. Oral melanotic. I don't like the examples of that on the tongue. Too big. I would worry about that. So nevus, a mole, a melanotic nevus, not very common in the mouth. And they usually occur on a certain area. most common, it's the most common tumor of all humans, but not in the oral cavity. All right, I think these are usually, there's several different types. There's junctional, compound, and nevus, and all depends where the nevus cells are. All right, if they're at the basal cell, it's called junctional. If they're in the connective tissue and the epithelium, it's called compound. Intradermal, if it's in the dermis. Okay, there's a blue net. You don't worry about those. Don't worry about those variations. Here's talking. You can read this. All right, just so you know that you guys don't need histology. But here's a nevus. Not very common in the mouth. A blue nevus is a certain kind. That looks like a hemangioma, but similar to the one we saw. Excisional so any pigmented lesion, if you can, you usually like to do an excisional biopsy on a pigmented lesion, if you can. All right, get it the first time. Here is a nevus, unusual one.
Can a nevus
Here's
also
another
be
nevus.
like-
Oh, this is one we saw on the
Yeah,
test.
you
Can a
said maybe it's
nevus
more.
be like a freckle too, or is that
They can look like a
a
freckle.
freckle?
Yeah.
Okay.
There is a little, yeah, can look like it. You don't see nevus. Here's a blue nevus. That's really unusual. I mean, that looks like a melanoma. So malignant melanoma is a malignancy of melanocytes. So melanocytes, okay? Third most common cancer of the skin. What's the most common cancer of the skin?
Squamous cell.
No,
Oh, wait,
Basal.
hold on.
basal cell.
Oh,
Basal,
in
yeah.
the skin.
On the skin.
Yeah.
What's the most common on the skin?
Basal.
Basal. No, basal is the most common.
Most common, yeah.
The second most common is what?
Malignant melanoma.
No,
Oh wait, malignant is that?
squamous cell.
Oh, okay.
And the
Oh,
third
nice.
is
It's malignant.
malignant melanoma. So it's tripled in the last 40 years. So here, lifetime risk for a Caucasian in the U.S. is 1 out of 100. So I've known several faculty members who have had melanomas, but they were caught early. So if they're not very deep, if they grow radially, not vertically, you got a good prognosis. But poor prognosis for an oral melanoma. They metastasize early, okay? So intraoral melanomas do not have a good prognosis. Skin melanomas do if you get them early. And here's the risk factor: fair complexion, light hair, tendency to sunburn, especially if you have a history of having a sunburn when you were young. Many years later, you may end up with a melanoma in that area. Yeah,
In the skin.
and the skin, where the severe sunburn. Yeah. Prognosis for oral melanoma, not good. See, 45% for 5 years, 28% for 10 years. But nowadays, prognosis for a melanoma is pretty good. All right, these are old statistics. Much better nowadays. Radial growth phase, cells spread laterally and confined to the surface epithelium. So you have good prognosis. Vertical is down, and so into the connective tissue, so your prognosis is not as good. There's different types. Superficial spreading, the most common form. You know, she's not getting into the different types. Male to female ratio, 2 to 1. Average age for melanoma is 40 to 70. Rarely occurs as a primary lesion in the oral cavity. Most of them in the oral cavity are metastatic from somewhere else in the mouth. But you can have. But here's the other important thing. 80% of melanomas in the mouth occur in the maxilla. That's something to remember. And most all the ones we saw were in the maxilla. Focal pigmentation in the mucosa is often seen several months to years before the malignancy. So often you will have a pigmented area that is a melanotic area, that, and in biopsy, and it's not melanoma, but they don't remove it. It can end up to be a melanoma. Yeah. So that's why you like to get rid of most pigmented areas in the mouth, if it's not, unless it's physiologic pigmentation or amalgam tattoo. If it's just a single small area, you like to get rid of it because of that. Early diagnosis is the key. Any lesion that is deeper than 0.75 millimeters has a greater tendency to metastasize. Yeah. Clark system, don't worry about that. Here's your A, B, C, and D. You see E's not even on here because that was added a couple years ago. So this is what? Look at above his lips. Look at his skin.
These dark.
No.
Physiologic pigmentation.
Yeah.
This is what?
Melanoma.
This is probably melanoma.
Melanoma.
Hope she gives
What is that
melanoma,
one?
Melanoma.
melanoma,
You just
early detection.
early.
Now for a break, what are we doing? Oh, Addison's disease. A destruction of the adrenal cortex, okay? Usually autoimmune disease could be a tumor. A lot of times it was TB, all right? So decreased levels of cortisol. So then that stimulates the pituitary, okay, and the ACTH output, and that increases the levels of melanin-stimulating hormone. You should remember that, okay?
Okay.
Generalized weakness and fatigue, vomiting, diarrhea, and you get pigmentation, bronzing of the skin, usually why on the elbows, in the area of irritation. Why a certain area in the face, the sun exposed areas, and in the mouth, it's a gingiva, okay? Oral pigmentation varies from light brown to black, or occurs on the gingiva, lateral tongue, buccal mucosa, and lips. Those are the areas that's irritated, all right? Treatment, steroid therapy. You take steroids, So here's Addison's disease. And then we saw this picture before.
Mm-hmm.
We saw this picture.
This one.
Q shaker you don't have. Rare. Foreign bodies. Got a perch in the sinus. I don't know. This is interesting. This is a foreign body. I saw this patient. I didn't see this patient. But there's my slides. And he had an injury from a motorcycle accident. And so you can see the pigmentation. This is a skin graft in the mouth. Okay, so where did the skin graft come from? He had a tattoo on his thigh. You see this over here? This is where they did the skin graft. And so this is the pigmentation from there. Do you get that, Sarah? You act like you
No.
don't understand.
That was on thigh, but it's now on the mouth.
Yes,
The blood took it out?
because they did a skin graft. He had an injury here. So they did a
I
skin
got
graft.
it.
So I have some pictures of the skin graft taken from somewhere on the skin. And there's hair growing in the mouth.
Wow.
Yes, yeah, yeah.
Why
So
did
I
they
call it
take it
I
from
call it a
somewhere
bad
else?
hair day. Okay, amalgam tattoos. Okay, we saw this picture.
Yes.
Yeah, and now you know,
Amalgam.
you can see the,
Mm-hmm.
where they made the incision, all right? Here's the
the
amalgam, look at the
Yes.
amalgam, all right?
Amalgam.
Here's the amalgam
Amalgam.
there. Here's my hand,
Is that
Oh.
actually your hand?
Yes.
that's my hand.
The one that you just showed us.
Yeah.
And this, you know that, because you got crowns on there, right?
Amalgam.
Amalgam. Lead you don't have, don't worry about that. Okay.
Yeah.
That's it. So, next week, you guys are gonna learn epithelial, and there's a lot to learn on that, okay?
We're gonna learn soft tissue, tumor and cyst.
Next week or?
Today is 18?
Uh-huh.
Okay, so next week is Thursday, 31st.
So you're gonna have your test Friday on epithelial,
General.
and
Yes.
pigmented,
Yes. Yeah.
right?
Friday we have a test, post test.
Yeah, and Thursday we have a test on soft tissue, right?
Yeah.
And
Yes.
soft tissue, that's fibromas and things like that.
Mm-hmm.
Yeah.
And we have first exam. On November 8th.
Oh, you
Okay.
guys, but
Yeah.
that's, I know that, that's gonna be in general fact, right?
General path,
Yeah.
yes.
Okay. Is it possible to have smokers melanosis and nicotine stomatitis at the same time in the palate?
Yes, yeah,
Okay.
yeah, you could,
Okay.
yep, you could, yep.
All right. Awesome.
Okay, Remember, you can share that with.
Oh, cool.
Thank you.
You guys want to start with it?
Uh,
Or should I look at it and then,
yeah,
Yes.
we'll
and
just
then pass it along? Okay.
You guys know where he lives, right? You can.
We'll hunt you down, Brian.
Yeah.
We'll hunt you down.
It's all
And the
mine.
PowerPoint. Do you have the flash drive?
Yes.
Okay.
All right.
Thank you so
I'll see you
much.
guys.
Thank you, Dr.
Okay.
Bianca.
Thank you. Yeah.
Study hard.
Will do.
Sounds good, we will.
Yes. Thank you.
All right.
We'll make it. Alright. Bye.
All right. See ya.
Oh, I forget my box. Have a good weekend.
All right.
Bye.
I'll follow you.
Bye. Have a good weekend. I'm hungry. I'm tired.
Yeah.
I want to go home. Yes,
Yeah.
reservation too.
Yeah.
You want the new one?
Yeah, new one. I also took FMX.
Oh, I did too.
Oh, I saw you there.
So, was he qualified for CBC, SME?
Most likely, yes.
Oh.
Because he does have a lot of bone loss. Oh,
He was
moderate.
long.
Yeah. And he does have a lot of calculus. But
Did you pass your epithelial?
no, I have to still do it. Probably, I think I'm gonna do it next. Oh, thank you.
We're going to pass it on him.
Yeah, I have to do it next Thursday on him. So,
Do your best to pass on one quad, so you're going to
Yeah.
do SRP on the other side.
oh, I see.
Yeah, because I failed on one side,
Okay.
and I didn't use that patient for both.
Oh,
Yeah.
yeah, that's really hard.
So I raised my patient to just pass eligibility.
What, oh, so they let you pass
If
eligibility?
you pass, you can do SRP on the other side.
But
If you
if-
don't pass,
if
you
you don't
have, you can use the other side for CBC eligibility.
You can or you can't?
You can.
Oh, I see.
You
But-
can do it.
But,
If you pass
yeah, what's that?
eligibility,
Yeah.
CBC, you cannot do it.
Oh, you can't do the CBC?
No, you can do SRP.
Oh, I'm the one that put that makes sense. So, you want to
Hi.
we were just meeting with our group to.
Are you meeting here today?
Oh no, just in radiology, actually.
Mm-hmm.
I don't know if they're here or.
Go. Cell number?
And see, that's for the radio, all of it.
Yeah.
Thank you.
Yeah, go talk to them.
Do
All day locked it.
Oh.
Isn't that a fool?
Yeah, I mean,
Go in the front.
Yeah. Okay.
thank you. That means they're gone before going home.
What's up? Yeah. Yeah. Seriously.